थैंक यू वेरी स्वीट ऑफ यू। ठीक है, चलो क्लास चालू करते हैं। विद इन 10 seconds वी गोना स्टार्ट द क्लास। आई लेट एवरीवन कम। सो कैसे हैं आप सब लोग? यस, आई मिस्ड यू टू। डॉक्टर ईशा, ओमकार, लायन, धर्मा गर्ल, हेलो सर, लुकिंग हैंडसम, थैंक यू सो मच। आई होप आप यू आर वाचिंग द इंस्टाग्राम एंड यूट्यूब स्टेटस ऑल्सो, एंड वी आर आई एम ट्राइंग माई बेस्ट टू लूज वेट। मेरा वजन बढ़ गया था बीच में। And I hope you guys are doing great. Life is beautiful. Life is amazing. And today is a very beautiful class to share some good amount of knowledge. And we're going to revise. It's a 4 hours class. The session, what we call, will finish by 9:45. जल्दी से मोती की तरह चालू करते हैं और खत्म करते हैं बढ़िया बढ़िया. Let's start the session in a very beautiful way and finish it off. Let's start it. Hello everyone, my name is Dr. Anand, and today's topic of choice we're going to start with is nothing but growth and development. Before starting any segment, we always have a beautiful quote, and the beautiful quote for today is what? The beautiful quote for today is work until you feel Dubai is cheap. Work until you feel Dubai is cheap. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. Life is the most beautiful gift you can ever have in life. Enjoy the show, enjoy the day. It feels good. Okay, don't worry, ho jayega clear. You guys will clear. I'm good, I'm doing great, and let's just do it. Exam entrance question number one. What is pedia and what is theatrics? Could you answer in the comment, please? What is pedia and what is theatrics? We all know that pedia means child and theatrics means healer. Pedia means child and theatrics means healer. A lot of questions, lot of crazy stuff with every within these 4 hours. दिल से पढ़ेंगे, बिल्कुल मोती की तरह खत्म करेंगे. Beautiful. We're gonna start the class and finish in time. So the first question, I got an idea. Pedia means child and pediatrics means healer. Number one. Number two, till what age group do we cover in pediatrics? So the age group we cover in pediatrics is till 0 to 18 year of life we cover in pediatrics. 0 to 18 years of life we cover in pediatrics, and the Greek meaning of pediatrics is child healer. Next questions we have is this one: prenatal, natal, and postnatal period. These all are the previous year questions. What is ovum? What is embryo? And what is fetus? Okay, let me zoom it a little bit. So, what is ovum? What is embryo? And what is fetus? Dr. Isha, you are the best. You are the best. So, what is ovum? 0 to 2 week of gestation. When the mother is pregnant and the baby is inside her, the beginning 2 weeks of gestation is known as ovum. 3 to 8 weeks is known as embryo, and 9 weeks till birth. 9 weeks till birth is known as fetus. Life is beautiful, guys. With a very happy, relaxed note, let's start this class. Let's beautifully do it, and it will be done. It will be done. Okay, that's what. Last 3 year question paper are really very important, and this is what we're going to discuss today. I'll repeat again, very important, that ovum, embryo, and fetus. 0 to 2 week of gestation is known as ovum. Embryo says 3 weeks to 8 weeks is known as embryo, and 9 weeks till birth is known as fetus. Dr. Isha, these are the PYQs only. Whatever coming right now on the screen are the previous year question. Pallavi, Gautam, yes, the question which are important are in front of you. तो दिमाग की बत्ती बुझाएं और सामने ध्यान दें. ठीक है. Now, very important. This part is done. I'll repeat again. In this beautiful class, I've got 5 questions. I got it. Number one, the Greek meaning of pediatrics is child healer. Pedia means child and pediatrics means healer. When the mother is pregnant, 0 to 2 weeks of gestation is known as ovum. 3 to 8 weeks is known as embryo. And from 9 weeks till birth, 9 weeks till birth, that is known as fetus. Now, next question, please. Yes, very common questions. Very important. Yes, what is neonate? What is early neonate, late neonate, and infant? My HOD always used to say common things are common and rare things are rare. Okay. So, what is a neonate? Any idea? 0 to 28 days of life. Beautifully answered by Smiley, by J, iPad Pro, Vivo V2246. ऐसा लग रहा है मैं mobiles की वो कर रहा हूँ publicity. iPad Pro. We have all hi-fi people over here. Okay. Yeah. Yes. When the mother is pregnant in the beginning 28 days of life, like the newborn baby is 0 to 28 days of life, whereas 0 to 7 days of life is known as early neonate, and 7 to 28 days is known as late neonatal period. What is an infant? Infant क्या होता है? 28 दिन से लेके 1 साल तक का बच्चा. From 28 days of life till 1 year is known as infant. From 28 days of life till 1 year is known as infant. Beautifully answered by Smiley, Bridge Bhushan Singh Yadav, Bridge Brijbhan Singh Yadav and Vivo V2246. What is toddler? If 28 days of life till 1 year is known as infant, what is a toddler? So please remember 1 to 3 years of life. 1 to 3 year of life is known as toddler. Can we please appreciate the points 1 to 3, 3 to 6, and 6 to 12? 1 to 3, 3 to 6, and 6 to 12. 1 to 3 year of life is known as toddler. 3 to 6 years of life is known as preschool, whereas 6 to 12 year of life is known as a school going period. Please, I'll repeat again. Please tell yourself whatever you're reading right now, you're reading for the first and last time in your entire life. Okay, so ऐसे पढ़िए कि बस ये देखा, पढ़ा, खत्म, मुझे याद है, ऐसा होना चाहिए. I read it, I saw it, finished, done, I remember. So I'll repeat again. In this beautiful class, I got an idea about the toddler, preschool, and school. That is 1 to 3, 3 to 6, and 6 to 12. Adolescent period, very very important. Adolescent period कब चालू होता है, कब खत्म होता है? Adolescent period, when does it start and when does it finish? So we have 10 to 13 year of life, that is early adolescent period. Then we have 14 to 16 year of life is the middle adolescent period, and 17 to 19 year of life, that is a late adolescent period. I'll repeat again, very important: 10 to 13, 14 to 16, and 17 to 19. 10 to 13 year of life is the early adolescent, 14 to 16 is the middle adolescent, and 17 to 19 year of life is the late adolescent period. I'll repeat again, these all are the PYQs for the FMG. Early adolescent period is a previous year question, late adolescent period is a previous year question. Remember that, okay? I hope you're able to understand. I should have zoom out a little bit. Okay, perfectly fine. I hope my voice is coming to everyone. Please let me know. Is my voice coming to everyone? Should I zoom in little? Any problem? Anytime you can let me know, please. Okay. Yes, our main thing is that we should learn and revise as much as possible. Here and there, screen lag will happen, bro. That is okay. It's very normal. Maybe it will just take some 2 minutes for the connection to set proper, and it will be fine. Don't worry about it. I'll repeat again. In this beautiful slide, I've got an idea that 0 to 2 week of gestation is known as ovum, 3 to 8 weeks is known as embryo, 9 weeks till birth is known as fetus. Then also I got an idea that 0 to 28 days of life is a neonatal period, 0 to 7 early neonate, 7 to 28 late neonate, and 28 days of life till 1 year known as infant. Then 5 more previous year questions I've already covered, that 1 to 3 is a toddler, 3 to 6 is a preschool, 6 to 12 is a school going period, and adolescent period basically starts from 10 year of life and is finished by 19 year of life. 10-year-old baby will be a school going period, remember that, or you can say early adolescent period. Now next question, very simple, very easy, अच्छे से खत्म करते हैं. Yes, can you please tell me in the comment section? Yes, Sam has already answered. Abhishek Kumar Pandey, AMJ, very good. What is the normal weight of a newborn? The normal weight of a newborn, very very important. It is from 2.5 to 4 kg. 2.5 to 4 kg is the normal weight of a newborn. And what is the average Indian baby weight? Average Indian baby weight is 3 kg. Okay, please remember 2.5 to 4 kg is the normal weight of a newborn, and the average Indian baby weight is 3 kg. So if 2.5 to 4 is the normal weight of a newborn, then what is less than 2.5? Less than 2.5 kg will be less than 2.5 kg will be low birth weight. And what is less than 1.5 kg? That will be very low birth weight. Very good. People who are answering has a very 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 high chance they will surely clear the exam. जो लोग जवाब दे रहे हैं बहुत ही अच्छी बात है. Try to give as many answers as possible. That's okay. You should answer as much as possible. I'm very sure you will clear. I'll repeat again. I got an idea that less than 2.5 is low birth weight, less than 1.5 is very low birth weight, and less than 1 kg is extremely low birth weight. Done? Very good. Next question. Which is the most commonest cause of neonatal mortality in India? भारत में जो छोटे बेबीज हैं वो क्यों एक्सपायर हो रहे हैं? Which is the most commonest cause of neonatal mortality in India? So we have Pulkit Sharma, Sonam Umesh, iPad Tanuj, AM Abhishek Kumar Pandey, and Shivam answering so beautiful, so elegant, just looking like a wow. So the most commonest cause of neonatal mortality in India is prematurity, prematurity, prematurity. The most commonest cause of babies dying in India is because they are premature. is because they are premature or because they are preterm? Exam entrance question number one, how do you define a preterm? The answer is less than 37 weeks baby will be known as a preterm baby. Am I right or wrong? Yes, very good. So why, sir, the baby is dying in India? You told that the preterm baby die in India very common. Why, if a baby is preterm, why he will die? Because of the deficiency of surfactant. Yes or no? Exactly. In our lungs, basically, there is something known as surfactant, and because of deficiency of surfactant, babies will die. So surfactant is formed by what? Surfactant is formed by, very, very important, by the type 2 pneumocytes of the lung. Please दिल से पढ़ें, खुश होके पढ़ें, मुंह बना के ना पढ़ें. मुंह बना के पढ़ेंगे तो मुंह बनाए हुए नंबर आने, फिर रोना पिटना है बाद में. हाय, इतनी पढ़ाई की थी, भगवान खुश नहीं है मेरे साथ, बड़ी पढ़ाई की थी. मुंह बना के पढ़ोगे तो मुंह बनाए हुए नंबर आएंगे. लाइट होके पढ़े, हैव अ लाइट फेस, है ना. हाँ, अब दिखने में अजीब दिखते हैं तो उसका कोई हल है नहीं. मोस्ट इंपॉर्टेंटली, वेरी इंपॉर्टेंटली, द surfactant is formed by what? Surfactant is formed by the lungs. Where in the lungs? By the type 2 pneumocytes of the lung. Very, very important. Okay. Next question. When are you expecting the surfactant in the amniotic fluid? And when are you expecting the surfactant in the lungs? I'm expecting the surfactant in the amniotic fluid by 28 weeks of gestation. When the mother is pregnant and she has a baby inside her, if the baby is 28 weeks, if the mother is pregnant and you are expecting the surfactant in the amniotic fluid by 28 weeks and in the lungs by around 33 to 35 weeks. These all are the previous year questions. All are the previous year questions. Has everyone understood this much? Yes or yes? Yes, please let me know. ठीक है, अच्छी बात है. बीच में गाने भी सुनाएंगे, शायरी भी सुनाएंगे, सब कुछ सुनाएंगे. ठीक है, डन. नेक्स्ट क्वेश्चन. द नेक्स्ट क्वेश्चन आई हैव इज वेरी, वेरी इंपॉर्टेंट. If the mother is a case of polyhydramnios, which problem you will rule out in the baby? I'll repeat again. We have a newborn baby and the mother is a case of polyhydramnios. Okay? Please tell yourself whatever you're reading for the first and last time. Okay. If the mother is a case of polyhydramnios, which problem you will rule out in the baby? Polyhydramnios means too much of liquor. Too much of liquor means too much of urine. What is the liquor? Baby's urine only is liquor. No, I'll repeat again. If the mother is a case of polyhydramnios, polyhydramnios means too much of liquor. Too much of liquor means too much of urine. Means baby passing urine very well. Baby passing urine very well, but he's not able to swallow the urine. Why he is not able to swallow the urine? Because you need to rule out a problem known as tracheoesophageal fistula. Beautiful answer by Smiley, AM, iPad, Abhishek Kumar, iPad Pro, and Abhishek Kumar Pandey. Okay, I'll repeat again. In this class, I got a beautiful idea that if the mother is a case of polyhydramnios, baby में क्या problem हो सकता है? That is tracheoesophageal fistula. Exam entrance question number one. What is the classification for TEF? The answer is gross classification. Okay, number one. Number two, which is the most commonest type of tracheoesophageal fistula? The most commonest type of tracheoesophageal fistula is type C, followed by type A, and the least common is type D. Yes, type C followed by type A, and the least common is type D. That is one thing. Very, very important. Okay. Exactly. And if the mother is the case of oligohydramnios, which problem I should rule out in the baby? Oligohydramnios means लाइकर नहीं बना है, decreased लाइकर. लाइकर क्यों नहीं बना है, कैसे बनता है लाइकर? By the baby's urine. Decreased liker means decreased passage of urine, and decreased urine. Why decreased urine? Because the baby's kidneys are not working properly. Kidney banati hai na urine. So you should rule out renal agenesis. That's what exam entrance question number one. If the mother is a case of oligohydramnios, which problem you should rule out in the baby? The answer is renal agenesis. And they ask in exam, renal agenesis is a part of which syndrome? So renal agenesis comes under, very, very importantly, Potter syndrome. Potter syndrome का बच्चा present कैसे करता है? How does a Potter syndrome baby present? Number one, that baby basically his lungs are not formed properly. Number one, pulmonary hypoplasia. Number two, oligohydramnios. Pulmonary hypoplasia, oligohydramnios, twisted face and twisted body. Twisted face and twisted body. I'll repeat again. What is Potter syndrome? Very importantly, Potter, very important. The mnemonic on only is Potter. P for pulmonary hypoplasia. O for oligohydramnios. T for twisted face and twisted body. Sir, how will I remember? Sir, looks very difficult. Bro, this one, bro, the picture is there. No, can you see the twisted face of the baby? That's what twisted face and twisted body. Okay, that's what an extremities defect and renal agenesis. That finishes the Potter syndrome. Photographic memory plays a very important role. That's very true, my dear iPad Pro. Has everyone understood this much? Yes or yes? Please let me know in the comment section. That's very, very important. Okay, I'll repeat again. So this part is done. Let's go to the next one. And what do you call it? And very important quote, very, very important, which says, do your best. Very beautiful quote. It says, do your best and destiny will do the rest. Do your best and destiny will do the rest. Please remember, very, very important, you are born for a reason. Okay, you are born for a reason. Never stop believing you were born for a reason. नहीं नहीं, मैं तो कंपाउंडर बनने के लिए आया था. कंपाउंडर नहीं बनना किसी को, हम यहाँ से डॉक्टर बनने आए हैं. So very importantly, do your best and destiny will do the rest. That's very importantly. And yeah, Potter syndrome, that part is done. Yeah, this part is done. Okay, done. Next one. Now this someone was commenting कि X-ray क्या है. So very, very important. Could you please what you called? Okay. Yes, Dr. Isha. Anytime you can take the interview, not a problem. So yes, if I am a new student and I can see this X-ray, so can we appreciate, very, very important, that there's some coiling of the tube. So very important. The patient has a coiling of the nasogastric tube. So the patient has a coiling of the nasogastric tube, and that is seen in TEF. Okay, coiling of the nasogastric tube is seen in tracheoesophageal fistula. Yes, exactly. Let's go to the next one. Yes, very, very important. Let's do this. I hope the screen is visible to you. Is this fine? Yes, exactly. Please fix the slides. Okay. Yeah, so yeah, that's what. So अभी I am gonna put the screen like that only, तो ये अब हिलेगा नहीं, ठीक है. So ये स्क्रीन को हम ऐसे रखेंगे और कोशिश करेंगे कि ये स्क्रीन ना हिले, ठीक है. आई होप यू आर एबल टू सी दिस मच, राइट. ओके, हाँ, आईपैड कह रहे हैं पेपर लीक कर दो. हाँ, कुछ और ना लीक कर दूं. मैं पेपर कैसे लीक करूंगा? मैं पेपर मैन थोड़ा बनाया, ठीक है. So very, very importantly, anthropometry, beautiful point, a beautiful quote which says, die with memories, not dreams, guys. Die with memories, not dreams. Okay, you have to die with memories. Okay, if you guys, do you think you guys can clear? Yes or no? Can you answer in the comment section, please? अब स्टूडेंट्स उससे देख, पता नहीं, देख लो, कोशिश तो कर रहे हैं यार, देख लेंगे. सो अगर देख लेंगे तो शक्ल और तुम्हारी जिंदगी भी देख लेंगे जैसी ही होगी. Will you bloody clear this exam? Do you think you have the guts to clear this? Yes, sir. I was born to clear it. Yes, sir. I will clear it. Yes, sir. I've already cleared it, sir. Let's party. Okay, नहीं, ये तो बहुत ज्यादा हो जाएगा, ठीक है. So that's very important. And if you guys clear, come to Delhi. I'll take you to a nice place. We'll have a nice 3-course meal. It'll be fun. Okay. Great. Exam entrance question number 1. What is the expected weight of a 1-year-old? Can you please answer in the comment section? Muhammad Ali Khan beautifully answered. Remember 1-year-old is 10 kg. Just remember 1-year-old is 10 kg. Why should I remember 1-year-old is 10 kg? Because as the age increases, the weight increases in even numbers. Remember that. I'll repeat again. Just remember 1-year-old is 10 kg because as the age increases, the weight increases in even numbers. Means 2-year-old will be 12 kg, 3-year-old will be 14, 16, 18, and 20. So these formulas you should know: 1, 2, 3, 4, 5, 10, 12, 14, 16, 18, 20, like that. Okay. So 1-year-old is 10 kg. That's the best answer. Weight doubles by how many months and triples by how many months? Again, a previous year question. Doctor, my newborn baby was 2.5 kg. When he will become 5 kg? Double कब होगा birth weight से? So weight doubles by 5 months and triples by 1 year. Weight doubles by 5 months and triples by 1 year. Next question. What is the normal length of a newborn? Any idea? The normal length of a newborn is around 50 centimeter. The normal length of a newborn is around 50 centimeter. So very, very important. 50 का 100 कब होता है? When does length doubles and when does length triples? So 50 का 100 happens by 4 years and 50 का 150 happens by 12 years. I'll repeat again. In this beautiful slide, I've got the idea that length doubles by 4 years and triples by 12 years. Length doubles by 4 years and triples by 12 years. And weight doubles by 5 months and triples by, very importantly, 1 year. ठीक है? Oppenheimer says nice cut. वो गजनी कट करवाया मैंने. I hope it's looking sexy. Okay. And what about 1 year old? Can you please answer in the comment? एक साल के बच्चे का कितना होता है height? What is the expected height of a 1 year old? So 1 year old will be 75 centimeter. Please remember. Yes, 1 year old is 75 centimeter. Exactly. कति जहर. Thanks, bhai. ठीक है. So 50, 75, 100 and 150 is what I got the idea. So that finishes one more important point, that height doubles by 4 years and triples by 12 years. Next question. What is the expected height formula? Yes, Abhishek Kumar Pandey, Chetan Yadav. So beautiful. Everyone answering so crazy. Definitely you guys will clear. Okay, you were born to clear, dude. तुम पैदा ही हुए थे क्लियर होने के लिए. Very importantly, हाँ, वो आईब्रो वाला कट तो आज मैंने लास्ट वीक लगवाया था यहाँ पे करके. ठीक है. हाइट फॉर्मूला वेरी वेरी इंपॉर्टेंट. एज इंटू 6 + 77. परवेज हैज अ वेरी ब्यूटीफुल आंसर. एक एक्सपेक्टेड हाइट निकालने का फॉर्मूला 2 साल से 12 साल तक के बच्चों का. टू कैलकुलेट द एक्सपेक्टेड हाइट फ्रॉम 2 ईयर टू 12 ईयर, द फॉर्मूला इज एज इंटू 6 + 77. रिमेंबर दैट. What is the normal head circumference of a newborn? The normal head circumference of a newborn is 35 centimeter. Please remember that. मर्सिडीज ले लिया आपने? नहीं, मर्सिडीज नहीं, मैंने एक प्लॉट ही ले लिया और जितने की मर्सिडीज थी उतने का प्लॉट ही आ गया. So very importantly, what is the normal what you call head circumference of a baby? The normal head circumference of a baby is around 35 centimeter. Please, these normal things are important. Okay, what is the normal weight of a baby? 2.5 to 4 kg. Remember, what is the normal length of a baby? 50 centimeter. What is the normal head circumference of a baby? 35 centimeter. So these things don't forget. And how does the head circumference increases? So in the beginning 3 months of life, remember always 2, 1 and 0.5. 2, 1 and 0.5. Head circumference increases by 2 centimeter per month in the first 3 months. Then head circumference increases by 1 centimeter per month in the next 3 months. And then 0.5 centimeter per month in the next 6 months. Please remember that. Very, very important. These questions they're gonna ask in exam. आपने बेसिक रखनी आनी, ये लिख के आना वहां पे. ठीक है. So 2 centimeter, 1 centimeter and 0.5 centimeter. ठीक है. Very good. Next question. We had one more question. A 2.5 kg, a 2.5 kg newborn baby on the 5th day of life. On the 5th day of life, this 2.5 kg baby became 2.3 kg. Okay, there was a weight loss. Now you are the doctor on duty. What will you do? Parents are really worried. So this 2.5 kg baby who was there at birth, and by the 5th day he became 2.3. What to do? Nothing. Conservative management. ये normal होता है. This is normal for a baby to happen like that, because a newborn baby is lose 10% of weight. A newborn baby in the beginning 7 days of life, newborn loses 10% of body weight, and by the 10th day the baby starts to regains the weight. So these are the important questions. Again, PYQ, the topic is growth and development anthropometry. अपने 250 ग्राम ढक्कन जैसे दिमाग में ये हल्की फुल्की बात घुसी या नहीं घुसी? Did you get something in your beautiful 250 gram brains? Did you understand something? Yes or no? You can go put the answer in the comment section. A golden heart or a black heart or a blue heart. Remember that. Okay. Yes, exactly. Okay. ठीक है. Yes. ठीक है. Okay, fine, great. A quick 30 seconds break. इसमें गाना सुनाएंगे. कौन गाना सुनना चाहेगा? यस, गाने की फरमाइश की है बिट्टू टिक्की, अरिजीत, पुलकिल, ब्रिज भान सिंह यादव और चमनपुर ने, और हीना और स्माइली ने जमशेदपुर से. ओके, कौन सा सुना है? अब तो बहुत नए नए गाने सीख रहा हूँ. मुझे मेरी म्यूजिक क्लास बहुत अच्छी चल रही है. अच्छा, एनिमल का गाना सुनाओ. अच्छा, और कुछ, और कोई ख्वाहिश तुम्हारी? एनिमल की तरह कपड़े उतार के दिखाऊं ना? वेरी इंपॉर्टेंट. अच्छा, गाना कौन सुना है? सबको हो रही है, हाँ सबको हो रही है, खबर चुप के दो दिल मिल रहे हैं, मगर चुप के. The next topic of choice we have is normal growth instruments. Very importantly, yes, the normal growth instruments. And before starting any segment, we always have a beautiful quote, and this quote says, "You are your only hope." Please remember, guys, you are your only hope. हम हमारे ही हैं. मतलब, like, this is very important, bro. You must admire yourself. You must fall in love with yourself, and you must motivate yourself. Okay, life will be so good. Life will be so good. You have no idea. No, 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 I want to have a girlfriend. So all that thing is not required. Okay, just enjoy the show and enjoy your own company. Yes, Shubh Patil, you are very well right. Exam entrance question number one: name the instrument shown in the picture. This instrument, very very important, is known as infantometer. Infantometer. Why do we use it, sir? To take the length of the baby, we use this instrument known as infantometer. What about this instrument? What do you call it? This is known as stadiometer. Stadiometer. Why do we use it? To take the height of a baby, we use stadiometer. Do we have a demarcation age wise that इतने साल से कम के बच्चे को infantometer use करते हैं? So yes, less than 2-year-old baby, we use the lying down height or the infantometer, and less than more than 2-year-old baby, we use the stadiometer. More than 2-year-old baby, we'll tell the baby to stand up and take the height. Very good, that's right. Okay, what is this instrument? Very, very important. What do you call this instrument? So these two instruments are same. Okay, I mean to say this instrument, very, very importantly, and this instrument, they both are same. This and this are same. So what do you call this? This is known as stadiometer. Stadiometer. This is not stadiometer, my ass. So this is what is the instrument. Very importantly, this is known as Herpenden caliper. Yes, Herpenden caliper. So why? What is the use of Herpenden caliper, sir? Basically, to take the very importantly skin fold thickness. Yeah, exactly, skin fold thickness. I'll repeat again. This instrument is known as Herpenden caliper. It is basically I'm taking the skin fold. Skin fold लेके आप क्या कर रहे हो उसका? मैं उसका thickness check कर रहा हूँ. I'm taking the thickness of the skin fold, basically to how much body fat is there in my body. How much body fat is there in my body is basically used for that. That you should know. Exactly. Yes, Shubh Patil, my dear, is just it is used at multiple areas like a subscapular level, like the triceps level, supraspinatus level. Lot of levels we can use these instruments. Very true. Hanji, very, very important. Next question. What is microcephaly and what is macrocephaly? Very, very important. How do you define microcephaly and how do you define macrocephaly? एग्जैक्टली, वेरी गुड, स्मॉल हेड. ये मेरे कुत्ते ऑस्कर को ही पता है कि स्मॉल हेड होता है, लेकिन पास होने के लिए हमको पता होना होगा हेड सरकमफ्रेंस लेस देन -3 स्टैंडर्ड डेविएशन. दिस इज नोन एज माइक्रोकेफेली. एंड हेड सरकमफ्रेंस मोर देन 2 स्टैंडर्ड डेविएशन, this is known as macrocephaly. So microcephaly and macrocephaly, remember that. Okay, head circumference less than -3 standard deviation and head circumference more than 2 standard deviation. And if I here only if I link and study, मरने से पहले link and study, how do you define short stature? So short stature is defined as what? Short stature मतलब height छोटा है ना, height का problem है, means height less than third percentile. Height less than third percentile, that is known as short stature. याद रहेगा ये? I'll repeat again. Head circumference less than -3 standard deviation is microcephaly. More than 2 standard deviation is macrocephaly. And short stature, very importantly, is height less than third percentile. ये definition याद करना है. चेतन यादव says ऑस्कर एग्जाम दे रहा है इस बार? हाँ जी, ऑस्कर एग्जाम दे रहा है इस बार, उसने तैयारी थोड़ी थोड़ी कर रखी है. Next question, very very important. Next page we have is, I hope you can see the whole slide. This is the upper segment lower segment ratio. That's what they ask in exam, guys. We have to clear this. Okay, hello, we have to clear this exam. 149, we don't want 149. Okay, if you don't feel like studying, just imagine 149, then you will start studying. Okay, very, very important. Okay, the screen is totally cleanly there. I hope, are you able to visualize the screen? Please let me know in the comment section. Thank you so much. Next question we have is upper segment lower segment ratio. Yes, don't worry, last time you got 149, don't worry, you will get it, you will get it. Okay, yeah, I'm not zooming it. Okay, it's totally zoom out, मैं कुछ भी नहीं कर रहा अभी, ठीक है? Okay. The next question we have is upper segment, lower segment ratio. Okay, it takes 3 seconds. Okay, dear, I got it. So the normal upper segment, low, this is the upper segment we all know, and this is the lower segment we all know. The upper segment, lower segment ratio at birth, it is 1.7 is to 1. At 3 year of life, it is 1.3 is to 1. And at 7 year of life, it is 1 is to 1. Very common previous year questions, very common. So the USLS ratio, upper segment, lower segment ratio, 1.7 is to 1, 1.3 is to 1, and 1 is to 1 is important. और क्या हो सकता है? Either there could be a decrease upper segment, lower segment ratio, or there could be a increase upper segment, lower segment ratio. I'll repeat again. There are two problems can happen: either a decrease upper segment, lower segment ratio, or increase upper segment, lower segment ratio. Okay, we all, what are the causes of decrease USLS ratio? So we all know this is known as nominator and this is known as denominator. When the nominator decreases, the whole ratio also decreases. When the nominator decreases, the whole ratio decreases. So nominator means upper segment. In what all condition upper segment can decrease? All the spinal problems. All the spinal problem. What are the spinal problems? Number one, TB spine. Very importantly, number two, kyphoscoliosis. Kyphoscoliosis. Oppenheimer is so beautifully answering. Very good. So TB spine, kyphoscoliosis. At least remember Allegili syndrome. Allegili syndrome is an important PYQs for FMG. Allegili syndrome. I am a new student. Can you please tell me Allegili syndrome में क्या होता है? Number one, in Allegili syndrome, you will have a butterfly shaped vertebra. That's what they ask in exam. Very good, Parvez. So butterfly shaped vertebra you see in Allegili syndrome, and the most common congenital heart disease in Allegili is pulmonary stenosis. So all these are questions. Remember, the most common congenital heart in Allegili is pulmonary stenosis, and the butterfly and the vertebra basically is butterfly shaped vertebra. Can you tell me one more syndrome where you see pulmonary stenosis? Beautiful, amazing answer by Bhavna, Pankaj, Parvez, iPad Pro, Oppenheimer, and Abhishek Kumar Pandey. The most common congenital heart disease in Noonan syndrome is pulmonary stenosis. I'll repeat again. In this beautiful slide, I got some 10-15 questions very importantly. So the most common, very importantly, the most common congenital heart in Noonan syndrome is pulmonary stenosis, and the most common congenital heart in Allegili syndrome also is pulmonary stenosis. Next question, please. What are the causes of increase upper segment, lower segment ratio? The causes of increase USLS ratio, at least three you should know. That is rickets, hypothyroidism, and achondroplasia. Rickets, hypothyroidism, and achondroplasia are the important examples of increased USLS ratio. Rickets, hypothyroidism, and achondroplasia are the three important examples of the increased upper segment, lower segment ratio. So these are the very, very important questions. Please appreciate that. Okay, very good. Let's go further. I'm going down now. I hope my voice, everything is going okay. Microcephaly and macrocephaly, we have done that. Can you please tell me how do you define microcephaly? Head circumference less than minus 3 standard deviation is micro, whereas head circumference more than 2 standard deviation is macrocephaly. Very good, perfect answer. Has everyone understood this much? Yes or yes, yes. एक घंटा हो गया, 1 hour is almost getting over, guys. It's only a 4 hours class, जल्दी खत्म हो जाएगा, ठीक है? Yes. Okay. A quick 10 seconds break. Relax. 10 seconds break. You have got this. Life is beautiful. Okay. You have got this. Don't worry. Okay. Yes. सब गाते हैं, सब ही मदहोश हैं, हम तुम क्यों खामोश हैं, साजे दिल छेड़ो ना, चुप हो क्यों गाओ ना. हो गया, 30 seconds हो गया, ठीक है? नेक्स्ट क्वेश्चन प्लीज. ओके, अच्छा, someone is saying how many girlfriends you had? I had just few, not much. Okay. Yes. Thank you, iPad Pro. So, next question, please. The next topic of choice we have is very importantly X-ray wrist. X-ray wrist. Before starting any segment, we always have a beautiful quote. Okay. Yes, and the quote is: "Be humble. We all have a past. Be humble. We all have a past." Okay. So we all have a past, guys. Just we have to be humble and nice. Life is beautiful. Life will make sense. Okay. जस्ट एंजॉय द शो. जिंदगी बहुत अमेजिंग है. जस्ट एंजॉय. ओके, एग्जैक्टली, या सब अच्छा होगा. अच्छा, कोई कह रहा है हेयर फॉल हो गया. ओके, नो प्रॉब्लम. हेयर फॉल का इलाज भी है, पहले पास हो जाओ, ठीक है. Next question. Exam entrance question number one. What are the carpal bones? Lateral to medial. Yes, exactly. So lateral to premiedial, the carpal bones are. She looks too pretty. Try to catch her. Right? Very good. Very good. So क्या क्या की bones थी वहां पे? Number one, very importantly, we have something known as scaphoid. She looks too pretty. Scaphoid, lunate, triquetral pisiform, scaphoid, lunate, triquetral pisiform, trapezium, trapezoid, trapezoid, capitate and hamate. Capitate and hamate. So these are the carpal bones, very importantly, from lateral to medial. She looks too pretty. Try to catch her. Scaphoid, lunate, triquetral pisiform, trapezium, trapezoid, capitate, and hamate. Very good. Exam entrance question number one. Doctor, which is the first carpal bone to appear in a baby? The first carpal bone to appear in my baby is capitate, which comes by 2 months. Doctor, which is the second carpal bone to appear in a baby? The second carpal bone to appear in a baby is hamate, which comes by 3 months. Leave the pisiform aside. Leave the pisiform aside. Why? Which is the last carpal bone to appear in a baby? The answer is pisiform. 3 MCQs over. Now, very importantly, which is the third carpal bone to appear in a baby? First carpal is capitate. Second carpal is hamate. Third carpal. So remember 3, 3. At 3 years of life, the third carpal bone is triquetral. ऐसे one more thing, remember 4, 4. At 4 year of life, the fourth carpal bone the baby will have is lunate. And remember 5, 5. At 5th year of life, the fifth carpal bone a baby will have is scaphoid. So 5 साल के बच्चे में 5 कार्पल बोन होती है, 4 साल के बच्चे में 4 कार्पल बोन होती हैं. 5 year old will have 5 carpal bones, 4 year old will have 4 carpal bones, 3 year old will have 3 carpal bones. So these are the important carpal bones. Please remember that. I'll quickly revise. So in this beautiful class, I've got an idea that she looks too pretty. Try to catch her. The first carpal bone to appear in a baby is capitate, comes by 2 months. Hamate comes by 3 months. Last one to come is the pisiform. Third one to come is the triquetral, then lunate, then scaphoid. Now, very, very importantly, one more thing we should know. Yes, my dear Pulkit Sharma. And yes, आकाश गुप्ता, उसका पिसिफॉर्म का रेंज है 8 से 12 साल. तो वो एग्जाम क्वेश्चन नहीं, तो इसलिए हमने बोला नहीं उसके बारे में. ठीक है डियर. Yes, my dear, you are right. Next question, please. Okay. For a newborn baby, which X-ray is good for the bone age estimation? Bone age estimation. We have a newborn baby. The mother expired. I don't know the age of the baby. Now, how will I get to know the age of the baby? You get the X-ray done. Okay. X-ray will tell us very nicely which X-ray is good for the newborn baby. N for newborn, N for knee joint. I'll repeat again. If I open hammer कह रहा है उसकी मम्मी से पूछो, पर मम्मी तो एक्सपायर हो गई. If we have a newborn baby, the mother got expired. अच्छा, एक और आया हिसाब किताब, कह रहा है कि पापा से पूछ लो. तुमसे ना पूछ ले, क्या पता तुम ही जिम्मेदार हो उस चीज के. मतलब क्वेश्चन वैसे कहता है कि भाई अगर इफ अ न्यूबॉर्न बेबी हैज इज देयर एंड मदर इज नॉट देयर, टू कंफर्म द एज व्हाट एक्सरे इज इंपॉर्टेंट. यस, आधार कार्ड हाँ तुम्हारा है, पहले ये अपना देख लो एक बार. तो एक्सरे नी जॉइंट विल बी अ वेरी गुड एक्सरे फॉर अ न्यूबॉर्न बेबी. For 3 months to 9 months, what is the best X-ray for the bone age estimation? X-ray shoulder. X-ray shoulder. Okay. For 1 to 13 year, the best X-ray will be X-ray wrist. Basically, we'll be checking the ossification centers in these cases. Okay, इन सब में ossification centers check करते हैं. That's it. 1 to 13 year of life we're gonna get X-ray wrist, and after 12 years usually the answer go for elbow or hip for the bone age estimation. In my neat in my neat super speciality question, this question had come. This bone age X-rays you're doing, this is done by using which method? What is the name of this method? Parvez has a very beautiful answer, that is Grulich Pile Atlas. Grulich Pile Atlas and Tanner Whitehouse method. The name of the method is Grulich White Atlas and Tanner Whitehouse method. This is the very importantly, क्या बोलते हैं उसको, yeah, exactly. This is the one you need to know regarding the this estimation. What you call the X-ray is compared by using which these methods: Grulich, Pile, Atlas, and Tanner Whitehouse method. That's important. Okay. Yes. Trapezoidal trapezium. Yes, my dear नयन, वो याद नहीं करना, इसलिए मैंने वो बताया नहीं. वो भी 5 साल पे आ जाती है, तो मैंने फिर बताया नहीं, तो कोई है ना, याद नहीं करना. ठीक है. Has everyone understood? Yes or no? Very important. इतना समझ में आ गया, my dear? Quickly. Perfect. Let's go to the next topic. Very importantly, we are now exactly with the good speed. हमें बहुत easily syllabus cover कर लेंगे आप 6:30 भी. Okay, yeah. So yes, exactly. Okay, someone says let's repeat. Okay, fine. Just quickly I'll repeat it. So in this beautiful class, I've got an idea that she looks too pretty. Try to catch her. The first carpal bone to appear in a baby is capitate, which comes by 2 months. The second carpal bone to appear in a baby is hamate, which comes by 3 months. The last carpal bone to appear in a baby is pisiform. Third carpal bone to appear in a baby is triquetral, comes by 3 years. Then 4 and 5. Okay, that you should know. Yes, we have Tanuj who says, sir, please have some water. So sweet of you. Love you for that. Okay. Yes. समझ में आया, कुछ नहीं समझ में आया, please let me know yes or yes. Please. Thank you. Aishwarya says, sir, big fan. Thanks, Aishwarya. Very kind of you. A quick 30 seconds halt, and we're going to start again because we are on time. Nothing to worry. Life is beautiful. So quick 30 seconds break. और उससे मुझे फिलहाल एक ही शेर याद आ रहा है. तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता. तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता. दुनिया में जीने के सिर्फ 2 ही तरीके हैं, एक तुझे नहीं आता, एक मुझे नहीं आता. So this is a little old share, but I like this a lot, so I just remember that. Okay. Yes. 15 seconds more. We still have time. Relax yourself. Watch this sutta break. अभी नहीं, अभी थोड़ी देर बाद मिलेगा. You can have it. It's an online course, so no problem. Pulkit Sharma says, sir, last 5 day strategy. Last 5 day strategy. Number one, don't break up with your girlfriend. Very importantly, don't study anything new. Okay, don't get into fight. Do physical workout. Make sure one day before the exam also you're going to gym and at least doing some 100 push-ups. Okay. Ganu says, I don't fight with girlfriend. Okay, cute, very nice. Last 17-day strategy. Okay. 17-day strategy. Just chill out. Make a good timetable. The whole story is about making a good timetable. Okay. Timetable. If you have a timetable, you are a rock star. Make a timetable and religiously follow it. That's the thing. Okay, time's up. Let's start again. Hello everyone, my name is Dr. Anand. A beautiful day today. How is everyone doing? The cutie pies, इतना cute वो जो है आप लोग cute messages कर रहे हैं. क्या डॉक्टर ईशा कह रही प्रीवियस ईयर क्वेश्चंस करने चाहिए कि नहीं करने चाहिए? ये हम PYQs ही कर रहे हैं माय डियर, ये PYQs ही हैं. The topic of choice we have is dentition. Before starting any segment, we always have a beautiful quote, and the beautiful quote is, be stronger than your excuse. Be stronger than your excuse. What is the excuse? I got a breakup. What is the excuse? Oh, I have only 2 girlfriends. What is the excuse? COVID ho gaya mere ko. What is the excuse? What's the excuse? Tell some good excuse, no, which you have. So whatever excuse you have, tell yourself that one, and then post traumatic stress disorder. Okay, yes, okay, hangover. Yeah, hangover is okay, that's very normal. Okay, they can, in at this time I think old monk is sounds good, but you have to be stronger than your excuse. That's the main thing, bro. You have to be stronger, 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 stronger than your excuse. Okay, remember that. Exam entrance question number one: what is the dental formula? Dental formula. Okay, 2123 by 2123. Very, very important. 2123 by 2123 is the normal human dental formula. Sir, I did not understand, sir. Sir, what is this 2123 by 2123? So we have two incisor, that is 2, 1, 2, and 3. Remember. So we have incisors, canines, premolar, and molar. Yes, my dear Akash Gupta, you are very right. Two incisors, one canine, two premolar, and three molars. That's what 2123 by 2123. Exam entrance question number one: doctor, when will be my baby's first primary teeth will come? What is the meaning of primary teeth? Primary teeth means temporary teeth. The first temporary teeth to appear in the baby is the lower central incisor, which comes by 6 to 7 months. Okay, which comes by 6 to 7 months. Please remember, very, very important, 6 to 7 months and 6 to 7 years. Why, sir? Why are you telling me 6 to 7 years? Because the first permanent teeth to appear in a baby is the first molar, which comes by 6 to 7 years. याद रहेगा ये? अपने 250 ग्राम दिमाग पे थोड़ी सी घुटने में खारिश करें, जितने जिनके घुटनों में दिमाग है, घुटने पे खारिश करो, दिमाग बढ़ेगा. Very, very important in this beautiful class. I got the idea. The first, yes, the first temporary teeth to appear in a baby is the lower central incisor, which comes by 6 to 7 months. The first permanent teeth to appear in a baby is the first molar, which comes by 6 to 7 years. Which is the last permanent teeth to appear in a baby? The last permanent teeth to appear in a baby is the third molar, which comes after 18 years. Beautifully told by Smiley, Sonam, Shubh Patel, Bridge, Happy Soul, and iPad Pro. The last permanent teeth to appear in a baby is the third molar. Yes, exactly. Yeah. क्या बोलते हैं? That is comes by 18 years. Okay. And which is the last primary teeth to appear in a baby? That is the second molar, which comes after 18 months. Which comes after 18 months. Last time I'm repeating again. The first temporary teeth to appear in a baby is the lower central incisor, comes by 6 to 7 months. The first permanent teeth is the first molar, comes by 6 to 7 years. 6 to 7 months, 6 to 7 years. ऐसे याद रखना है, 18 months, 18 years. 18 years you will have the last permanent teeth, that is the M3, and 18 months you will have the last temporary teeth, which is the M2. M2, M2, M2. Okay, 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 okay. Next question, please. What are the causes of? Okay, let's do the simple one. If I start with this one, supernumerary teeth. Supernumerary teeth मतलब बोले तो multiple teeth at one location is known as supernumerary teeth. This is one MP previous year question, which is the most common location for a supernumerary teeth. Multiple दांत बच्चे के कहाँ पे आते हैं? Options are incisors, canines, premolars, and molars. The answers you can see in the video, also in the image, also the incisors. Basically, the very important, yes, remember that the most common location for a supernumerary teeth will be incisor, incisor, incisor. Next question: causes of delayed dentition. Which is the most commonest cause? Let's do the MCQ. Okay, which is the most commonest cause of delayed dentition? Most commonest. Yes, Pavan, you're right. Hypothyroidism can cause delayed dentition, but which is the most commonest cause of delayed dentition? Now, very, very important. We all know the mnemonic was fried cap. Fried cap के अंदर जो I है ना, I for idiopathic. Idiopathic is the most commonest cause of delayed dentition. That is the previous year question. आई रिपीट अगेन, डॉक्टर मेरे बच्चे के दांत जो हैं वो बहुत लेट आ रहे हैं. ठीक है, सो क्यों लेट आ रहे हैं? व्हाट आर द कॉजेस? द मोस्ट कॉमनेस्ट कॉज इज इडियोपैथिक, बट द अदर कॉज आर fried cap. F for familial. My father mother had a problem of delayed dentition, so I am having delayed dentition. R for rickets. Okay, yes, very true. That's right. Sonam, very good. E for endocrine causes. Okay. D for Down syndrome. Very, very important. And C for cleidocranial dysostosis. Cleidocranial dysostosis. Remember, these are the important causes. Yes, very true. Smiley, Abhishek Kumar, people who are answering, huge chance you will surely clear. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है, रोने पिटने से अच्छा है कि जो टाइम बचा है पढ़ लो, क्या पता पास हो जाए बहुत अच्छे नंबरों से. यस माय डियर, प्रोजेरिया में भी होता है फ्राइड कैप. पी फॉर प्रोजेरिया आल्सो, डेफिनेटली वेरी वेरी ट्रू. I'll repeat again. My baby has got a delayed dentition. What are the causes? The mnemonic is fried cap, familial, rickets, idiopathic, endocrine, Down syndrome, cleidocranial dysostosis, and progeria. And which is the most commonest cause? Idiopathic. मेरे को नहीं पता. Very good. And this one, cleidocranial dysostosis, वो क्या चीज होती है? So this one, this is cleidocranial dysostosis. How will I remember, sir? Absent clavicle. The patient has absent clavicle. This is what the important point of the cleidocranial dysostosis, absent clavicle. Remember that. Very good. Perfect. Very good. So beautiful. Very good answers. Okay, let's go further. Let's go further. Yes. Okay, I'm just zooming for the one time. Yeah. What are the causes of natal teeth? What are the causes of natal teeth? छोटे बेबी का दांत आ गया. I'll repeat again. Newborn baby have got a teeth. Just now I got to know that a baby should have a teeth by 6 to 7 months of life, but a newborn baby only have got a teeth. Very beautiful answer. We have the mnemonic PEES. P for Pierre-Robin syndrome. P for Pierre-Robin syndrome. E for Ellis Van Creveld syndrome. Pierre-Robin syndrome. E for Ellis Van Creveld syndrome. Very importantly, I'll drag it down. Yes. Another E is epidermolysis bullosa. Very good, Smiley. Very good. Epidermolysis bullosa. And S for Soto's syndrome. S for Soto's syndrome. So these are the important points on the what you call causes of natal teeth. PEES, Pierre-Robin syndrome, Ellis Van Creveld syndrome, epidermolysis bullosa, and S for Soto's syndrome. Soto's syndrome. So these are the important points. Remember of the what do you call? Yes, exactly. Causes of the natal teeth. Yes, that's true. Has everyone understood this much? Pierre-Robin syndrome. They ask in exam. The patient has micrognathia. Micrognathia you will see in a case of Pierre-Robin syndrome. एंड सोटोस में क्या मिलता है? सोटो से मिलता है पॉइंटेड चिन. Pointed chin, yes, very true. Pointed chin you will see in a case of Soto syndrome, and micrognathia you will see in a case of Pierre-Robin syndrome. And if I ask you a random question, single palmar crease, where do you will see single palmar crease? Any idea? Smiley has a very beautiful answer. Pandey, Parvez, Abhishek Kumar, Brijbhan, Ghanu. Yes, Aishwarya, very good. Down syndrome. ये जो पढ़ रहे हैं ये पहली और आखिरी बार पढ़ रहे हैं. Whatever you're reading, bro, you're reading for the first and last time. Okay, so that's it. Okay, very very important. Okay, let me ask you 5 random questions. In which condition do you see absent clavicle? Exam entrance question number 1. The answer is cleidocranial dysostosis. हाँ, क्लीडो भी लिखोगे चलेगा. Very good. In which condition do you see single palmar crease? The answer is Down syndrome. In which condition do you see micrognathia with glossoptosis? The answer is Pierre-Robin syndrome. Next question, which is the most commonest cause of delayed dentition? The answer is what we call idiopathic. And one more thing, how do you define delayed dentition? There was a question here. How do you define delayed dentition? So very, very important. Yes, iPhone is right. No teeth by 13 months. Yes, if a baby has no teeth by 13 months, then you will say, हाँ, this is a problem, and you will call it delayed dentition. That finishes this whole page also. Has everyone understood? Yes or yes? Yes? Hmm. चीयर्स. हाँ, ये वोडका नहीं है, ये चीयर्स. दिस इज नॉट वोडका. इट कुड बी टकीला बट इट्स नॉट वोडका. Okay. Now, very, very important. Yes, perfect. Yes. Let's go to the next page. A quick 30 seconds pause. Again, a 30 seconds break. I want you guys to have a lot of breaks in between. Relax yourself. It's okay. No problem. ऑस्कर तो लेटा है वहां पे, वो बाहर कोई बार्क कर रहा है. अब बहुत अच्छा होगा. यू विल गेट परफेक्ट अमेजिंग रिजल्ट. अमेजिंग. बहुत अच्छा होगा, बहुत अच्छा होगा. मैं बता रहा हूँ, बहुत अच्छा होगा. Now, very, very important, a beautiful quote also has come in between. Okay. Yes, yes. Okay. बाहर कोई डॉगी वो कर रहा है, ऑस्कर तो शांति से बैठा है. ठीक है. इज एवरीवन ओके? लाइक यू वांट, या 5 मिनट्स ब्रेक थोड़ी देर बाद देते हैं, थोड़ा सा और पढ़ लो, फिर 5 मिनट्स ब्रेक दे देंगे प्रॉपर. ठीक है. अच्छा, कौन सा गाना सुनेंगे? वो तड़पाए मुझे तेरी सभी बातें, एक बार है दीवाने, झूठा ही सही प्यार तो कर, मैं भूला नहीं हंसी मुलाकातें, बेचैन करके मुझको मुझसे यूं ना फेर नजर. आगे की लाइन नहीं आती मेरे को. ठीक है. इंग्लिश प्लीज. दिस इज अ हिंदी सॉन्ग. आई डोंट नो द इंग्लिश ऑफ दिस, सो दैट्स व्हाट. या बी प्राक का मैं गाना वो एनिमल मूवी वाला सीख रहा हूँ यार. ओके. ओके, लेट्स कंटिन्यू प्लीज. यस. ट्रांस एग्जैक्टली पुलकित. सो या, बिफोर स्टार्टिंग इन इंग्लिश सॉन्ग आफ्टर सम टाइम. जादू सुनाएंगे, जादू. यहाँ कौन है, ये क्या बोल रहा है ये? हाँ. यस माय डियर होस्ट, दिस इज फॉर बोथ क्लास इज इंपॉर्टेंट. लेट्स कंटिन्यू. यस, सो लाइफ इज ब्यूटीफुल. हेलो एवरीवन, लेट्स कंटिन्यू नाउ. बिफोर स्टार्टिंग द नेक्स्ट सेगमेंट, अ क्विक कोट. व्हाट इज द मोटिवेटिंग कोट फॉर टुडे? द मोटिवेटिंग कोट फॉर टुडे इज, डोंट स्ट्रेस द could haves, dude. Don't stress the could haves. If it should have, it would have. Don't stress the could haves. I wish I could have done better in my relationship. I wish I could have studied well. I wish I had better time. I wish I had little more days. No, I would have done really well. Don't stress the could haves. If it should have, it would have. Okay. So work hard. Life will make sense. Don't worry about it. Let's go to the next topic, please. Yes. Yeah. Hello, everyone. We have a next page and the next topic of choice. Beautiful. We have is the sequence of changes of puberty. What are the various sequence of changes of puberty that we should know, which is important for the exam? And a very beautiful quote, अच्छा बाद में करेंगे ये, which is the first visible sign of change of puberty in a girl? Which is the first visible sign of change of puberty in a girl? Very, very important. That is the thelarche. The first visible sign of change of puberty in a girl is X star mark PYQs. That is thelarche. What is thelarche? Thelarche is breast development. Number one. Number two, very importantly, which is the last sign of change of puberty in a girl? Very importantly, is menarche. Very important, menarche. And yeah, so first visible sign and last visible sign are always the exam question. The first visible sign is the breast development, and the last visible sign is the menses. That is the one exam question. In the boys, which is the first visible sign of puberty in a boy? The first visible sign of puberty in a boy, in the boys, it is bottom to top. So number one, testicular enlargement. So testicular enlargement is the first visible sign of puberty in a boy. The first visible sign of puberty in a boy is testicular enlargement. And which is the last visible sign of puberty in a boy? Yes, beard. Very right, very good. Facial hair. Facial hair. So first visible sign is testicular enlargement. Last visible sign is facial hair. First visible sign is breast development, and the last visible sign is menarche. Okay. These are the 4 MCQs over. Next, very importantly, a boy he is growing well or a girl is growing well. Which staging is used basically? Number one, we use something known as SMR staging. The staging we use is known as SMR staging. What is SMR staging? Sexual maturity rating staging. A boy is growing well or a girl is growing well we use a SMR chart, the SMR staging, that is the sexual maturity rating staging. And for that SMR staging, we use a chart, and the chart name is Tanner's chart. That is Tanner's chart. Now you have four MCQs. In which stage of the SMR, like I'll repeat again, SMR staging is there. We have stage 1, stage 2, stage 3, stage 4, stage 5. In which stage of the SMR there is increase in the length of the penis, and in which stage of the SMR there is increase in the girth of the penis. So remember, in the stage 3 SMR there is increase in the length of the penis, and in stage 4 SMR there is increase in the girth of the penis. Number one. Number two, in which stage of the SMR you have darkening of scrotum. Darkening of scrotum also it is seen in stage 4 SMR. Darkening of scrotum is also seen in stage 4 SMR. I'll revise again. In which stage of the SMR there is increase in the length of the penis? Stage 3. In which stage of the SMR there is increase in the girth of the penis? Stage 4. And where do you see darkening of scrotum? Stage 4. Same goes with girls also. In which stage of the SMR there is generalized breast development? The answer is stage 3. In stage 3 there is a generalized breast development. In which stage of the SMR you have the nipple and areola are separately seen? The answer is stage 4. In stage 4 SMR, you have the nipple and areola separately seen. So we have covered 10 MCQs. Very, very important. Okay. Very good. Next, what is the instrument? What is this instrument? Very, very important. So this instrument, very important, is known as orchidometer. This instrument is known as orchidometer. Basically, I'm going to check your testes. I'm going to check the testicular volume. Okay. I'll repeat again, very common exam question. Name the instrument. The answer is orchidometer, and it is done basically to measure the testicular volume. Please remember that. So around 10 to 12 MCQs are already over. Has everyone understood this much? Yes or yes? Please let me know in the comment. समझ में आ रहा है? थोड़ा थोड़ा हल्का हल्का क्यूट पोला पोला समझ में आ रहा है? नोने बेबीज को नोना समझ में आ रहा है या नहीं आ रहा है, बताइए. Great, perfect, very good. Okay, I hope everyone is doing well. Okay, one second, let me check. Slide number 5. Okay, 6:45, 7. Yes. Perfect. Let's go further. Okay, I hope you're able to get things, and that's why I'm just having a constant speed so that you guys are still alive. Okay, let me ask you 5 random questions. Question number 1. If I ask you question number 1, in umbilical cord, how many artery, how many veins do we have? Can you answer in the comment, please? In umbilical cord, we all know we have 2 artery and we have how many veins? 2 artery and 1 vein. Very, very important. We have 2 artery and 1 vein. So in umbilical cord, very importantly, we have 2 artery and 1 vein. If a baby has 1 artery and 1 vein, what will you think of? A newborn baby having 1 artery and 1 vein. Now, what do you think of? Very importantly, the answer is renal agenesis. Renal agenesis. That's again a star mark PYQ. I'll repeat again, very, very important. I got the idea in this slide that umbilical cord has 2 artery and 1 vein. If a baby has 1 artery, 1 vein, you will think of renal agenesis. And where else have you read renal agenesis? Do we have any syndrome which has renal agenesis? Very, very important. Porter syndrome. Porter syndrome, we all know that is having a renal agenesis. Porter syndrome will have renal agenesis. Very good, that's right. Okay, perfect. Okay, so now we have next, we have this slide. Yes, very important. How many sutures and how many fontanelle? A newborn baby has how many sutures and how many fontanelle? Any idea? So we have 4 sutures and 6 fontanelle. We have 4 sutures and 6 fontanelle. What are the name of the sutures? In the skull, in the front part, very importantly, we have metopic suture. Then on the side part, which suture we have? Coronal suture. And then we have the sagittal suture. And sideways, we have the lambdoid suture. So we have the metopic suture, coronal suture, sagittal suture, and what we call lambdoid suture. 4 sutures we have. And how many fontanelle we have? 6 fontanelle. What are the names? So we all know number 1, very importantly, number 1, we have the anterior fontanelle. Very good. Number 2, we have the posterior fontanelle. Very good. The more you guys are answering, the more chances you have, you will surely clear. Because अब ये समय इतना ही रह गया. Now the only time is revise, finish. That's the only time you have. Okay. So one anterior, one posterior, and then we have a pair. We have a pair of sphenoid fontanelle, and then we have pair of mastoid fontanelle. Means we have two sphenoid, two mastoid, one anterior, one posterior. So most importantly, please remember we have what we called four sutures and six fontanelle. Number one. Number two. Now there is something known as craniosynostosis. What is the meaning of craniosynostosis? Premature fusion of suture. Yes, premature fusion of the suture. समय से पहले अगर कोई suture fuse हो गया, before time, if any suture gets close, that will lead to a abnormal shape of the head. I'll repeat again. Before time, if a suture gets close, and that will be known as craniosynostosis. Okay. Common exam question: metopic suture. If metopic suture gets prematurely fused, what is the shape of the head? The answer is very importantly trigonocephaly. Yes, if the metopic suture gets prematurely fused, the baby will have trigonocephaly. If the coronal suture, if this suture gets prematurely fused, the baby will have, very, very importantly, is brachycephaly. Brachycephaly. Premature fusion of the coronal suture causes brachycephaly. Premature fusion of the sagittal suture causes dolichocephaly, and dolichocephaly is also known as scaphocephaly. Very good. Yes, Parvez, very good. And last but not the least, premature fusion of the lambdoid suture, it causes plagiocephaly. Yes, Chirag, Pulkit, Bhavna, Tanuj, very good, very good. So I'll repeat again. In this beautiful slide, I've got an idea that a newborn baby has what you called four sutures and six fontanelle. The sutures are metopic, coronal, sagittal, and lambdoid, and the fontanelle are anterior, posterior, and very importantly, pair of sphenoid and mastoid fontanelle. Okay. And one more question they ask in exam: ये anterior fontanelle किसके बीच में होता है? This anterior fontanelle basically is present between which bones? So we have the frontal bones over here, and then we have the parietal bones. So yes, anterior fontanelle is between the frontal and the parietal bones. That is one more MCQ. Next MCQ: when does anterior fontanelle closes? Anterior fontanelle closes by around 18 months. 17 years. तुम्हारा नहीं पूछ रहा मैं तुम्हारा कब बंद हुआ, तुम्हारा हुआ होगा 17 साल पे। वैसे तो बच्चे का 8 से 18 पे हो जाता है। So by 1.5 साल पे, by around 8 to 18 months of life, anterior fontanelle closes, and it is the last fontanelle to close. Yes, very important. Yes, Nutan, yes. Okay. Yeah, and also I'll repeat again: premature fusion of the front or metopic suture will cause trigonocephaly. Premature fusion of the coronal suture will cause brachycephaly. Sagittal suture will cause dolichocephaly, which is also known as a scaphocephaly. And premature fusion of the lambdoid suture will cause plagiocephaly. Plagiocephaly, remember that. Done. Next one. The next one we have is this one. Again, a very important picture. Yeah, lot of questions, lot of questions. Let's do the okay. So what do you think? A female with a webbed neck. A female with a webbed neck. What do you think? So female with a what you called a webbed neck. Of course, we all know we'll think of Turner syndrome. So I'm new to Dr. Anand classes. I don't know what are the other points of Turner syndrome. So the question will come: a female with short stature. A female with short stature with shield chest. A female with short stature with shield chest. A female with short stature with shield chest with widely spaced nipples. Okay, a female with widely spaced nipples with short stature with shield chest. Very importantly, think of Turner syndrome. And male patient with the web neck, you will think of Noonan syndrome. Noonan syndrome karyotype is normal, and Turner syndrome karyotype is 45XO. It is very important to get an ultrasound whole abdomen in Turner syndrome. Why? What do you see in that? Yes. It is important to look for the ovary in ultrasound whole abdomen and Turner syndrome because the ovaries are not working properly. The patient will have streaking of ovaries, and that will lead to infertility, and they will have periods issues also. Number two, the patient will have amenorrhea. So ovaries are not working properly. The patient will have amenorrhea. The patient, this one more thing, and also the patient will have absent bar body. Absent bar body. Okay. Yes, we all know. And one more thing, it's very important to get a ultrasound whole abdomen because of the, you will look for the kidney. And what kidney do you see in a case of Turner? Horseshoe shaped kidney. You will see a horseshoe shaped kidney. Okay. Yes, very important. I'll repeat again. I got an idea that doing an ultrasound of whole abdomen is important in a case of Turner because you will see the what you call the kidney issue, horseshoe shaped kidney. You will see the ovary issues, streaking of ovaries, and that lead to increase in the FSH and LH levels. So very importantly, yeah, there will be increase in the FSH and LH levels also in the case of Turner syndrome. And last question, tell me one syndrome where the IQ will be normal. The answer is Turner syndrome is one syndrome where the patient IQ will be totally normal. Remember that. And which is the most common congenital heart in Noonan syndrome? The most common congenital heart disease in Noonan syndrome is pulmonary stenosis, and the most common congenital heart in Turner syndrome is a bicuspid aortic valve. The most common congenital heart in Turner syndrome is a bicuspid aortic valve, and the most common congenital heart in Noonan syndrome is pulmonary stenosis. And yes, the most common congenital heart in Turner is bicuspid aortic valve, and the most common cause of death in Turner syndrome is coarctation of aorta. And what is the X-ray finding of coarctation of aorta in cardiology? The coarctation of finding will be figure of three appearance. Very importantly, exam question. Figure of three appearance is what you see in a case of coarctation of aorta. One more thing we have is fetal alcohol syndrome. How the patient will come of fetal alcohol? Fetal alcohol में remember सब कुछ छोटा हो जाता है, everything is small. The number one, the patient will have small head, that is what you call microcephaly. Number one, the patient will have microcephaly. The patient will have small eyes. The patient will have small head. The patient will have small eyes. The patient will have smooth philtrum. See, for every syndrome, important points are enough. Female with the webbed neck, Turner syndrome. Male with the webbed neck, Noonan syndrome. Smooth philtrum, thin upper lip, small eyes. You will think of fetal alcohol syndrome. Exactly, you will think of fetal alcohol syndrome. These are the important points. At least smooth filter and thin upper lip बोले तो बहुत important है. Okay. And if I ask you one more questions, 1 second. Okay. Page number, okay. कहीं लिखना है मेरे को. If the mother has taken danazol during pregnancy, if the mother has taken danazol during pregnancy, the baby can land up into virilization. Remember that. If the mother has taken misoprostol during pregnancy, any idea? The mother has taken misoprostol during pregnancy. M for misoprostol, M for Mobius syndrome. If the mother has taken misoprostol during pregnancy, the baby can land up into Mobius syndrome. If the mother has taken danazol during pregnancy, the baby can land up into virilization. If the mother has taken erythromycin during pregnancy, any idea? If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. And last question, if the mother has taken lithium during pregnancy, if the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. And what is the shape of the heart in Epstein anomaly? Box shape heart. Box shape heart. And why the mother is taking lithium? Any idea? She's taking lithium for bipolar disorder. She's taking lithium for the bipolar disorder. So if the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. And Epstein anomaly, you will have a box-shaped heart, and the mother would have taken lithium for bipolar disorder. Yes. Can we have a break? How many of you want break? Let me know. Thank you. Okay, fine. 10 minutes break. 7:10. We're gonna start at 7:10. Is everyone okay with that? Please let me know in the comment. Thank you. अब आधे लोग कह रहे हैं ब्रेक, आधे कह रहे हैं नो ब्रेक. 7:10 चलेगा, 12 मिनट रह गए. आई थिंक डन. Fine. We'll have a quick break. I'm doing mute now. 7:10. 7:10. We'll see you at 7:10. You have 12 minutes. Thank you. Pulkit, this if the mother has taken erythromycin during pregnancy, the baby can land up into CHPS, that is congenital hypertrophic pyloric stenosis. The break is still till 20 years of your life. Hello, everyone. Welcome to Pediatrics by Dr. Anand. Is my $1 million voice and face visible? Thank you. No face? Tanuj, इतने gorgeous face को how can you say no? So just now I'm having beetroot ka juice, which will make my skin shiny and amazing. So I recommend everyone of you to have beetroot juice. Thank you. Yes, Jay, करते हैं restart. 2 घूंट पी लूं juice. पी लिया मैंने आराम से. अहमदाबाद आ जाएं, बहुत जल्दी आएंगे. आप दिल्ली आ जाएं. आप दिल्ली आ जाएं. ओके, पेज नंबर 7. पेज नंबर 7. वन सेकेंड. Okay, let's do this. Let's do this. Hello, everyone. Yes, I like dark chocolate cake. It's nice. I'll send you my house address. You can send me through Swiggy. Thank you so much. Good evening, everyone. A beautiful day today. Let's talk about the next topic. The next topic of choice we're going to have is the milestones. It's like a bread and butter for a pediatrician. They ask a lot of questions on from the milestones. फिर वो अलग बात है, बच्चे अपनी बेइज्जती करा के वे आ जाते हैं. नहीं नहीं, मैंने पढ़ा था, लेकिन मैं भूल गया. The exam entrance question number 1. When does neck holding comes? एक बच्चा अपनी गर्दन कब संभालता है? When does neck holding comes? Very very important. Neck holding comes by 3 months. Very good, very good. That's beautiful. It said neck holding comes by 3 months. When can a baby roll over? A baby can roll over by 6 months. Beautiful answer. Neck holding comes. So look at the photo, please. Neck holding comes by 3 months. A baby can roll over by 6 months. 6 months, something else also happen. Sitting with support comes by 6 months, and sitting without support comes by 8 months. Sitting with supports comes by 6 months, and sitting without support comes by 8 months. Standing with support comes by 9 months, and standing without support comes by 12 months. Very good, very right. You were born rock star, you will get it. Look at the photo and finish it off. So sitting with support, ये वाला, sitting with support comes by 6 months. Sitting without support comes by 8 months. Standing with support comes by 9 months, and standing without support comes by 12 months. Photo, 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 and finish it off. Okay. I'll repeat again. This is a beautiful pediatrics class. 2 घंटे हो गए हैं, 2 घंटे रह गए हैं. In this class, I got an idea that neck holding comes by 3 months. Like a rollover comes by 6 months. Sitting with support comes by 6 months, and sitting without support comes by 8 months. Standing with support bole to that comes by 9 months, and standing without support comes by 12 months. Beautiful answer by Abhishek Kumar Pandey and Smiley. Very good. Next question. 9 से 12 महीने में 9 to 12 months of life, something happens. What happens? Number 1, a baby can cruise around the furniture. Cruise around the furniture, like by touching the furniture, the baby can cruise around the furniture 9 to 12 months. Then we have pivoting. What is pivoting, sir? Pivoting is turn around to pick the objects. When can a baby turn around to pick the objects? Very importantly, that is known as pivoting. Turn around to pick the objects. Beautiful answer. So very amazingly done. Please remember, very importantly, 9 से 12 महीने में दो चीज आती हैं, that is cruising around the furniture and pivoting. Now next very important point we must appreciate. See, one thing we know that when can a baby stand without support? 1 साल का बच्चा खड़ा कब हो सकता है? 1 साल का बच्चा 12 महीने पे खड़ा होता है. मतलब 1 साल का बच्चा 12 months baby can stand. When can a baby walk with the one hand held? Exactly. Just remember one word, bro, that a 12 months baby can stand. Why should I remember that a 12 months baby can stand? Because 12 to 13 months baby will walk with one hand held. 15 months baby will independently walk, and 18 months baby will run. and 18 months baby will run. See, 12 months baby can independently stand. 12 to 13 months with the walk will walk with one hand held. 15 months will independently walk, and 18 months will run. Are, where is he running? He's running to open the drawers of the almirah. He's running to open the drawers of the almirah. When can a baby open the drawers of the almirah? Same 18 months. And once he opened the drawers of the almirah, he found a book. He found a book where he's flipping 2 to 3 pages at a time. That also same only comes by 18 months. So 1.5-year-old baby who's running, who's opening the doors of the Almirah, who's turning 2 to 3 pages at a time. Everything is happening by 18 months or 1.5 year. And when can a baby flip one page at a time? By 24 months or by 2 years. Please remember that. Very important for exam question. They will ask in exam. At 15 months में 2P आता है, and 18 months you have 2D. In 15 months you have 2P, that means P for pointing towards someone. I want that girl, pointing towards someone, pointing. And another P we have is indicating wet pants, indicating wet pants. Dil se padhe, life is beautiful, bro, life is beautiful. Do it, just do it, just do it, you'll get it. Okay. यस ब्रिजभान, वेट पेंट नहीं, वेट पैंट, ठीक है. सो इंडिकेटिंग वेट पैंट्स, आई डिड सुसु इन द पैंट्स and I want to go to washroom. Okay, remember that. Okay, and 18 महीने का बच्चा क्या करता है? 2D करता है. चलेगा 2D. What is the 2D? One is dry by day and domestic mimicry. Dry by day and domestic mimicry. Dry by day means in the daytime he will be dry. Dry bole to he will not pass susu in the pants. In the daytime he will be dry. Whereas dry by night comes by 36 months. Double of 18 is 36. Okay. 1.5 साल का बच्चा दिन में सुसु नहीं करेगा और 3 साल का बच्चा रात में सुसु नहीं करेगा. Simple words. A 1.5-year-old baby will not pass susu in the pants in the daytime comes by 1.5 year, and in the night time very importantly comes by 3 years. So 1.5 year and 3 year, please remember that, very very important. Okay, they will ask you in exam, please remember this. Dry by day comes by 18 months and dry by night comes by 36 months. Remember, very important. Okay, domestic mimicry. If the mother is sweeping the floor, the baby is sweeping the floor. Same story comes by 18 months. Okay. So I assume 3 साल का बच्चा, I assume a 3-year-old baby, he will be dry by night. In the night time, he will not pass susu, he will be dry. And what is the age cutoff for nocturnal enuresis? Any idea? Exam entrance question number 1. The answer is 5 years. Anyone who is passing urine in the pants who is more than 5-year-old, it's a problem. It's a problem. Enuresis means passing urine and nocturnal means in the night. So that's a problem. Exam entrance question number 1. What is the age cutoff? The answer is 5 years. Exam entrance question number 2. What is the management? The answer is motivational therapy. Yes, beautiful, told by Shubham. Very good, my dear. Oppenheimer, very good. So we have the motivational therapy, or you can say the alarm therapy. This is the treatment of choice. And what is the drug of choice? D for drug and D for desmopressin. Desmopressin. Yes, Pulkesh Sharma, Hina, Prakash, Smiley, Brijbhan Singh Yadav. Beautiful. D for drug of choice. D for desmopressin. When can a baby knows his full name, age, and sex? I am Rahul. I am a boy. So a baby knows his full name, age, and sex by 3 years, and he can go to toilet alone by 4 years. He can go to toilet alone by 4 years. A baby knows his full name, age, and sex by 3 years, and a baby can go to toilet alone by 4 years. Okay. When can a baby ride a tricycle? Very easy. 3, 4, and 5. 3, 4, and 5. दिल से पढ़े, लाइफ बहुत अच्छी है, हो जाएगा, सबका बहुत अच्छा क्लियर होगा. You guys will rock it. All you have to do is just believe that I'll do it. That's it. Whatever you're reading, just tell I bloody remember it, and this will come, and that's it. Finish the whole game. And फिर हम कहीं हिमाचल चलेंगे, maybe शिमला तो नहीं, पर जम्मू साइड साथ जा सकते हैं. So a baby can ride a tricycle by 3 years, hopping by 4 years, and skipping by 5 years. 3, 4, 5. 3, 4, 5. Try bole to 3. 3-year-old can ride a tricycle. 4-year-old can do skipping, and 4-year-old can do hopping, and 5-year-old do can skipping. Okay. Hand regard. When does hand regard come? Again, remember 3, 4, 5. Again, story 3, 4, 5. 3, 4, 5, 3, 4, 5. Exactly. Yeah. So 3 months baby will show hand regard. अपने हाथों को appreciate करना. Hand regard. ये मेरे हाथ हैं. तुम्हारे एग्जाम के बाद तुम्हारा गला दबा सकता हूँ तुम्हारा रिजल्ट देख के. So these are my hands. I can kill you after exams. So 3 months baby will have hand regard. 4 months baby, whatever hands he has, that will come in the midline. And 5 months baby basically then do mouthing. What is mouthing? जो दो डॉग सा मुंह में डाल लेता है, whatever I give to my baby, he puts in the mouth. So 3 month baby will have hand regard. 4 months baby will have mouth, hand comes in the midline, and 5 months baby will have mouthing. Exactly, Prakash. Yes, सब मुंह में जो तुम डालते हो, ठीक है? So mouthing. Yes. Now holding. If I'm holding something very importantly, if I'm holding something with both the hands, if I'm holding something with both the hands, that is known as bidextrous approach. And if I'm holding something with one hand, that is known as unidextrous approach. Any idea कब कब आता है? When does bidextrous approach comes and when does unidextrous? So 4-month-old baby, he will hold something with both the hands, and a 6-month-old baby will have a unidextrous approach. 4-month-old baby will hold something with both the hands, whereas a 6-month-old baby will hold something with one hand. So bidextrous approach comes by 4 months, and unidextrous approach comes by 6 months. Very importantly. And one more question they ask in exam: immature and mature pincer grasp. So we have something known as immature pincer grasp and something known as mature pincer grasp. So immature pincer grasp comes by 9 months, and mature pincer grasp comes by 12 months. If I'm holding something with thumb and index finger only, if I'm using my thumb plus I'm using my index finger, that is known as mature pincer grasp. 1 साल का बच्चा अगर कुछ उठाता है, if a 1-year-old baby holds something, normally he holds by a thumb and index finger. Whereas if you're using the other fingers also, that is the immature pincer grasp, comes by 9 months. Exactly. केक पे कैंडल प्ले करना बहुत अच्छा है पुलकित. वेरी गुड ब्रो, वेरी गुड, वेरी नाइस. Next question. The next question we have is: look at this girl. What is the age of this child in front of you? Any guesses? What is the age of this girl? So very importantly, when can a baby tie the shoelaces? So a baby can tie the shoelaces by 5 years. A baby can tie the shoelaces by 5 years. Yes, very good. So we have 3 years, 4 years, and 5 years. So very importantly, dressing and dressing. When can a baby dress and dressing? The answer is 3 years. When can a baby, what do you call, buttoning and buttoning? The answer is 4 years. And when can a baby tie shoelaces? The answer is 5 years. So 3 years, 4 years, 5 years. A baby can dress and dress by 3 years, buttoning and buttoning 4 years, and tying shoelaces by 5 years. And this is very important. Okay, a baby knows his full name, age, and sex by 3 years, and a baby can go to toilet alone by 4 years. They ask in exam. Okay. Yes. One more question also. I have to put the slide little over here. This one. Now, very, very important. One is this picture and one is this picture. Any idea what comes first? Crawling comes first or creeping comes first? Any idea? So there is something known as CRAWL, crawling, and there's something known as CREEP, that is creeping. Alphabetically, A comes first and then the E comes. So number one, crawling comes first and creeping comes late. Crawling comes by 8 months and creeping comes by 10 months. This is known as crawling and this is known as creeping. Okay, crawling comes by 8 months and creeping comes by 10 months. Crawling comes by 8 months and creeping comes by 10 months. Remember, crawling comes first, creeping comes late. Remember that. Okay, very good. Last point, then this only is over. I have to zoom little bit. Okay, I'm sorry, thoda blur hoga. Yes. Now, very, very important, they ask in exam, when can a baby draw a straight line? Any idea when can a baby draw a straight line? Yes, Oppenheimer, very good. What is your full name, Oppenheimer? I have heard your ID somewhere. So baby can draw a straight line. A straight line has how many ends? 2 ends. Aishwarya, very good. So a 2-year-old can draw a straight line. A plus has how many ends? A plus has four ends. One, two, three, four. So a 4 year old can make a plus. A 2 year old can draw a straight line. A 4 year old can make a plus. Between 2 and 4 comes the three. A baby can make a circle by 3 years. And I'm making the circle with the left hand. Remember that. So means handedness. Handedness. My daughter is a left-handed or a right-handed. Handedness comes by 3 years. So straight line comes by 2 years, plus comes by 4 years, circle comes by 3 years. Yes, okay, yes, Oppenheimer, I got it. And handedness comes by 3 years. Then it is difficult for a baby to make 4 points together like that. So means rectangle or a square. A baby can make a rectangle or square by around 4.5 years. Okay, very good. It is difficult for a baby to make 3 points together, that is triangle. A baby can make a triangle by 5 years. What is this? This is known as a diamond. Okay. It is a neat PG question. The answer is 7 years. A baby can make a diamond by 7 years. And something else also is diamond shape. Any guesses? The answer is anterior fontanelle. Anterior fontanelle also is diamond shape, and anterior fontanelle fuses by 8 to 18 months. Yes, Oppenheimer, very good, Doc Saab, very good. And a baby can make a diamond by 7 years. That's it. And then 8 year old becomes a doctor. 8 year old becomes a doctor because he can make a cross sign like that. Okay, this one. 9 year old baby can make a cylinder. 9 year can make a cylinder. And a 11-year-old baby can make a 3D cube. 11-year-old baby can make a 3D cube. That finishes the whole thing of milestones. Hmm. Cheers, Tanuj. ओके, जे पूछ रहा है टावर्स के बारे में, वो भी आसान है, खत्म करते हैं उसको भी. 1 सेकेंड. टावर्स टावर्स टावर्स. Okay, towers. So towers. Okay, if I say when can I, okay, can you tell me when can a baby scribble? A baby can scribble by how many months? A baby can scribble by 15 to 18 months. Okay, a baby can scribble by 15 to 18 months. Why, Anand sir? Why are you telling this point? A baby scribbles by 18 months, 15 to 18 months, because 15 months baby can make a tower of two cubes. 15 months baby can make a tower of two cubes, whereas 18 months baby, 18 months baby, he can make a tower of three cubes. 15 months baby can make a tower of two cubes, and 18 months baby can make a tower of three cubes. Okay, and cubes ka we have a formula, age into 3. Age into 3 is the formula. For example, 2 into 3 is how much? 6. So a 2-year-old can make a tower of 6 cubes. Remember, age into 3 is the formula, means age into age in years. 2 into 3 is 6. So 2-year-old can make a tower of 6 cubes. Same age into 3. 3 into 3 is 9. So a 3-year-old can make a tower of 9 cubes like that. So these are the important points, must appreciate. That finishes one more topic of the milestones. Has everyone understood this much? Yes or yes, yes, please let me know. समझ में आया या तिलंडे की तरह सब ऊपर से गया, कुछ भी आइडिया नहीं क्या हो रहा है यहाँ पे. जहां मुझ पे हंसता खुशी मुझ पे रोती, अगर तुम ना होते, अगर तुम ना होते. हाँ जी. थंब एंड इंडेक्स फिंगर, अगर बच्चा, इफ यू यूजिंग, इफ द बेबी इज होल्डिंग समथिंग विद थंब एंड इंडेक्स फिंगर, that is known as a mature pincer grasp, comes by 12 months. Peekaboo. When can a baby play hide and seek or peekaboo? 10 months. Yes, 10 months baby can play peekaboo. Very true. Yes, a quick 30 seconds break and then what it called, we'll start again. Thank you so much. आपके फोन पे क्या ब्रो समझा नहीं मैं. Very true. 15 more seconds. We're gonna start the next topic. I hope you guys are doing great. खुशी कह रही ब्रिज का गेट बता दो. हाँ, सब कुछ बता दूं, मैं सब कुछ ही बता देता हूँ. एक काम करता हूँ, 4 घंटे की क्लास है, 25 सवाल पहले पूछ लिए. जितना बताया है उतना करें और खुश रहें. धन्यवाद. ये भी बता दो, वो भी बता दो. मैं मोबाइल नंबर बता दो अपना, मैं वो तो है वैसे तुम्हारे पास. ओके, लेट्स डू. क्वेश्चन भी बता, क्वेश्चन, अच्छा अच्छा, पेपर बता दो, अच्छा जरूर। मेरे मामे ने पेपर नहीं बनाया, पेपर तो कोई और किसी और ने बनाया है। ओके। Yes, 5 seconds more. We're gonna start again. 5 seconds, 5 seconds. Yes, yes. मोबाइल नंबर, मेरा मोबाइल नंबर यही तो है. This is my mobile number, bro. Where is it? Where is it? Where is it? This one. This is my mobile number. If you have any doubt, you can WhatsApp me. If you have any question, doubt, you can WhatsApp me. And if I don't reply, no problem. You can WhatsApp me twice. Still, I don't reply, no problem. You can WhatsApp me again. Till the time I permanently block you from my WhatsApp, you can message me and you can tangofy me and परेशान me as much as possible. अच्छा, ऑलरेडी मैसेज आने शुरू भी हो गए. क्यूट. ये पीडीएफ कहाँ मिलेगी? ये पीडीएफ जकार्ता में मिलेगी. जकार्ता की फ्लाइट पकड़े, वहां से लेके आए. Yes. Hello, everyone. Good evening. A beautiful day to all of you. Today's topic of choice we're going to talk about is breastfeeding. Before starting any segment, we always have a beautiful quote. And the beautiful quote is sometimes, like, do it now, sometimes later becomes never. Do it now, sometimes later becomes never. Yes, sir. Once I finish my breakup, then I will start studying. Once my friend, she says Monday she'll be free. Monday is a very happy day to start studying. My girlfriend say it's a winter time, we'll study together in the night. Night, what all you'll do? You will not study. I am very sure by looking at your face. So no study, alone is best. What is the moral of the story? I was born alone, I will die alone, and I will study alone. That's the whole thing. Next question, please. Exam entrance question number one. In a busy labor room, you are the doctor on duty. Moti Akkal wale, you are the doctor on duty. The mother says, doctor, my baby is not feeding well. Doctor, my baby is not feeding well. Very importantly, how will you approach this case? Doctor, my baby is not feeding well. If your baby is not feeding well, the answer will be, could you please show me how are you breastfeeding your baby? Why, doctor? Why do you want to see why I am breastfeeding my baby? Number one, of course, because I would like to see the signs of good attachment. Maybe I would like to check the signs of good attachment. Exam entrance question number one. What are the signs of good attachment? Chin touching the breast. Chin touching the breast. Number two, mouth wide open with fullness of cheeks. Mouth wide open with the fullness of cheeks. Chin touching the breast. Mouth wide open with fullness of cheeks. Baby's lower lip is everted out. Baby's lower lip is everted out, and mother's upper areola exposed out. These are the wonderful signs of good attachment. I'll repeat again. The signs of good attachment are chin touching the breast, mouth wide open with fullness of cheeks, baby's lower lip. This is an exam question. Baby ka upper lip should be everted out or lower lip? Baby ka lower lip should be everted out. Yes, good, Tanuj. Mother's upper areola will be exposed out or lower areola. So mother's upper areola should be exposed out. Very good, Smiley. Very good, Bridge Bhan Singh Yadav. Very good, Parvez. Next question. In a normal vaginal delivery, when should I breastfeed my child? The answer is as soon as possible. Whereas in the case of cesarean section, the answer is within 4 hours, you should breastfeed your baby. When do you celebrate breastfeeding week? Any idea? The answer is 1st to 7 August. We celebrate breastfeeding week. Very importantly, what happens on 28 September? Any idea? Can you please tell me what happens on 28 September? Prakash? Yes, Smiley is right. World Rabies Day. World Rabies Day is on 28th of September. 25th of April, what is there? Any idea? 25th of April, any idea? Yes. Malaria. World Malaria Day. World Malaria Day is on, one second, page number 8. Yes, page number 8. Yes. So very importantly, what you called World Malaria Day on 25th of April. World Rabies Day on 28th September. Breastfeeding week in first week of August. And 25th April ko, yes. Something else also happened on 25th of April. One thing more, your birthday? No. 25th of April, what happened? The switch. Which switch? The switch of trivalent OPV to bivalent OPV. Trivalent OPV to bivalent OPV switch, where the P2 component was removed. Exactly, Prakash. Very good. And what do you call happened on 25th of April. 11th March. What happens on 11th March? Any idea? Yes, beautiful answer. It is daddy's birthday. Yes, it is my birthday. Yes, yes, yes. And where are we going on the birthday? The options are London. The options are Bihar. And the options are Pune or Ukraine. Please let me know. Russia, Russians. What do you mean? What do you mean by that? What do you mean by that? Okay, cute. Next question, please. What are the reflexes help in breastfeeding? What are the reflexes helps in breastfeeding? We have something known as milk secretion reflex. And who is responsible for milk secretion reflex? Any idea? Prolactin or oxytocin? Prakash says oxytocin. Milk secretion reflex, Prakash says oxytocin responsible. क्या हम प्रकाश को कोई गंदी गाली दे सकते हैं? Yes. Why? Because milk secretion reflex, remember, prolactin is responsible. Okay, prolactin. Yes. So P for prolactin. Prolactin is a very important. Yes, Pulkit. So milk secretion reflex is prolactin, whereas milk ejection reflex. Milk ejection reflex, who is responsible? Oxytocin is responsible. Yes. If I have to store the my breast milk in room temperature, for how many hours I can store? The answer is 8 hours. If I keep my breast milk in the fridge, I can keep it for 24 hours. And if I keep in minus 20 degrees Celsius, I can keep it for 3 months. What is the absolute contraindication of breastfeeding? If my baby is suffering from galactosemia, or my baby is suffering from lactose intolerance, or mother is on chemotherapy. These are the absolute contraindications. Basically, we need to know absolute contraindication for the breastfeeding: galactosemia, lactose intolerance, and mother on chemo radiotherapy. Next question. The next question we have is, breast milk is rich in which vitamin? Remember, the mother is feeding the child in AC room. Mother is feeding the child in AC room. So breast milk is rich in vitamin A and vitamin C. Breast milk is deficient in which vitamin? Breast milk is deficient in vitamin D, vitamin K, and vitamin B12 if she's a pure vegetarian. And my grandmother says भैंस का दूध सबसे बढ़िया. My grandmother says cow's milk is the best. Why cow's milk is the best? Any idea? मेरी दादी कहते हैं कि उसमें जो प्रोटीन्स होता है. So why cow's milk is the best? Very nice. It has more protein. Sounds amazing. Just yes, that's very true. Actually, cow's milk has more proteins, and that is why it is not good for my baby. For me, it is good, but not for my baby. Why for my baby is not good? Because cow's milk contains casein, which causes colicky pain. Cow's milk contains casein, which causes colicky pain. And breast milk contains what? Breast milk contains whey protein, and that makes the milk digestible. Whereas cow's milk contains casein, which causes colicky pain, which causes constipation, and which causes a problem known as CMPA. What is CMPA? Cow milk protein allergy. And in that, the patient passes bloody stool. The patient passes bloody stool. So these are the important points. In this slide, I got an idea that cow's milk is not good because it is rich in casein, and that casein causes colic, pain, constipation, and CMPA. Whereas breast milk is rich in whey protein, and that makes the milk very easily digestible. Identify the image shown in the picture. It's a previous year question for FMG. This is known as colostrum. Colostrum is rich in which immunoglobulin? IgG or IgA? A for Dr. Anand and A for IgA. Amazing things start from A alphabet, if just wanted to tell you. Next question, please. When do you celebrate World Malaria Day? We have done that. The answer is 25th of April. And also we have done the Doctor's Day that comes on 1st July. Rabies Day we finished 28th of September. And Children's Day we celebrate on 14th November. 14th November we celebrate Children's Day. 14th November we celebrate Children's Day. So 15th November onwards until 21st November we have the National Neonatology Week. Remember that, important for exam purpose. What about iron? Iron, no, iron is not deficient in breast milk. If the baby is a low birth weight, we usually give iron after 6 months of life. What are the calories if I talk about cow's milk and human milk? Each 100 ml of mummy's milk contains how many kilocalories? The answer is 65. And cow's milk contains 67. What about the calories in अच्छा ये तो हो गया sorry calories. What about the protein? Each 100 ml of mummy's milk contains how many gram of proteins? 1.1 and cow's milk 3.1. अगेन एन एफएमजी क्वेश्चन, गाय के दूध में ऐसा क्या होता है जो माँ के दूध से 3 गुना ज्यादा होता है? व्हाट इज देयर इन द मम्मी इन द काउज मिल्क विच इज 3 times मोर इन देन द मम्मीज मिल्क? दैट इज दिस ओनली, क्या था? प्रोटीन. प्रोटीन इज मोर इन द काउज मिल्क. Breast milk is deficient in everything except lactose. Lactose is very high in the mummy's milk, that is 7.4, and cow's milk 4.7 gram. Remember that, important for exam. Done. This part is done. Next question. Which is the first immunization of the baby? The answer is colostrum is the first immunization of baby. ये कौन बोला? Omkar says BCG, OPV and Hep B. ओमकार, ओमकार लड़का है कि लड़की? पहले तो ये बताओ. लड़की है तो मैं कुछ बोल नहीं सकता, और लड़का है तो मैं घर पे आके मारूंगा. हाँ जी, लड़का है. हाँ जी, तू आगे आ जा. कौन है ये भी ओमकार? हाँ जी, अपने मन में अच्छी से कोई गंदी गाली दो. हाँ जी, क्यूट. कौन से वाली? वो दूसरी, वो जो सबसे गंदी वाली है, वो वाली जो सुन भी नहीं सकते, वो वाली. अच्छा, हाँ जी ओमकार, ये तुमने बोला कैसे बीसीजी ओपीवी है? तुम्हें खौफ खत्म हो गया अभी? तुम्हें है क्या मुसीबत, प्रॉब्लम क्या है तुम्हारी? सो यस, यू आर राइट. यू आर राइट ओनली. क्या कहते हैं, यस, द फर्स्ट इम्यूनाइजेशन ऑफ द बेबी इज बीसीजी ओपीवी एंड हेप बी. बट इफ ऑप्शंस गिवन बीसीजी ओपीवी हेप बी एंड कोलोस्ट्रम, then I will choose colostrum because colostrum is that much important. That's why. And colostrum is rich in IgA. That is done. This part is done. And which is the first meal of the baby? Same story. The answer is colostrum. So these are the important points. Must appreciate. Remember that. ओके डन. ओके, क्या कह रहे हैं? मुझे सच में लगा कि गलत हुआ है क्या सर? तो गलत ही हुआ है बेटे. तारीफ नहीं कर रहा तेरी मैं. सुनेगा मुझसे संस्कृत में तू. आपकी तारीफ नहीं कर रहा मैं. डॉक्टर साहब, गलत जवाब दिया है आपने. बीसीजी ओपीवी होता है, लेकिन कोलोस्ट्रम के सामने अगर मैं पूछ रहा हूँ आपसे कि विच इज द फर्स्ट इम्यूनाइजेशन, तो फिर आंसर कोलोस्ट्रम ही बन जाता है. ठीक है. हैज एवरीवन अंडरस्टूड दिस मच? यस और यस यस, प्लीज लेट मी नो इन द कॉमेंट. थैंक यू वेरी मच. 8 to 8:15. तुमसे मिलने के दिन तो गए, तुम ना आए. A quick 20 seconds break. Prakash Pandya. Yes, my dear. अंकुश सेज क्लास कब तक होगी? 12 बजे तक. तुम्हें प्रॉब्लम है कोई? 12 बजे तक नहीं होगी. 9:45. द क्लास इज टिल 9:45 p.m. वी हैव 2 PDF files to finish. One is this, one is the other one. Isha says Okay, we have 25 seconds to go. 25 seconds break. We're gonna start again. Isha says weight loss tips. Yes, my dear. Number one, have 1 spoon of honey every day, and 1 spoon of what you called वो खाओ, क्या बोलते हैं, च्यवनप्राश. आई होप तुम खा रही होगी करके. और दौड़ो, खूब दौड़ें. Do a lot of running. Running is a good cardio, and it will definitely burn the extra fat which you have accumulated since your childhood. Yeah, yoga is a beautiful thing. Yoga is a very beautiful thing. Okay, last 10 seconds. You're gonna start again. Last 10 seconds. Yes, 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 yes. Hmm. अच्छे से पढ़ाई करनी है, ठीक है. एग्जैक्टली exactly, हाँ. फास्ट फूड कम खाओ. मैंने ना कहीं पढ़ा था ऐसे. मैंने कहीं बड़ा अच्छा सा एक पढ़ा था कि बाप के पैसों से फास्ट फूड खाओ, फिर बाप के पैसों से महंगे से नाइकी शूज खरीद के, और बाप के पैसों से महंगा सा जिम ज्वाइन करके दौड़ो. सो यही है लाइफ का रूल. देखिए, ये संसार है, यही संसार है. टाइम्स अप, लेट्स स्टार्ट. हेलो एवरीवन, वेलकम टू पीडियाट्रिक्स बाय डॉक्टर आनंद. We're gonna talk about the next topic, very beautiful topic. But before starting any segment, we're gonna have a beautiful quote. Who is this? Exam entrance question number one. Who is this? क्या कह रही? He's my boyfriend. Do you think he's your boyfriend? I doubt. I really doubt. But that's very commendable job, I must say. So he is Mark Zuckerberg. He is the पूजा का boyfriend. No, ये पूजा का boyfriend कैसे है? और नूतन कह रही है कि पूजा का boyfriend है. तुम्हें बड़ा पता है नूतन के पूजा का कौन सा boyfriend है. तुम अपना boyfriend देखो. I'll repeat again, very importantly, this is Mark Zuckerberg. He's the founder of Facebook. In the recent interviews, Mark Zuckerberg said that Facebook was not the first thing he had invented. He had invented a lot of video games, they all were failed. He had invented a lot of chat systems, they all were failed, and then came the Facebook. And who is she? Any idea? This is who you? Papa Ki Pari? No, she is not Papa Ki Pari. She is J.K. Rowling. She is the one who wrote Harry Potter. And then she says that Harry Potter was not the first book she had written. She had written 12 books and all books miserably failed. And then came the Harry Potter. Who is she? Bubbly? No, she is not Hari Puttar. What is Harry Puttar? Acha. She is Chirag says she is Lady Gaga. Can we please call Chirag on stage? Chirag says ये लेडी गागा है. भाई तुम एफएमजी छोड़ो, तुम पहले न्यूज सुना करो रोज, ठीक है. लेडी गागा कहाँ से आ गई ये तुम आईना देख कर आए हो, काला कौवा खा के आए होगे तुम शाम को. लेडी गागा कैसे होगी? आया बड़ा. हाँ जी. सो शी इज बियॉन्से. अच्छा, एक और आई है, राखी सावंत. वेरी क्यूट, नाइस. आई शुड नॉट आस्क सच क्वेश्चंस बिकॉज विल डाइवर्ट फ्रॉम द टॉपिक. शी इज बियॉन्से, एंड बियॉन्से इन अ recent interview she had told that she had written one of her favorite song is Halo, and she had written 100 songs and all songs were failed, and then came the Halo, and that gave her international popularity. So what is the one thing in common in all and in you and in me? He invented a lot of video games. He failed. Then came the Facebook. She failed in 12 books. And then came the Harry Potter. And she wrote 100 songs. And then came the Halo. So failure, exactly. Have the courage to fail. Have the bloody courage to fail. It's okay if you're answering wrong. It really doesn't matter if you're answering wrong. It really does not matter you got 149 or 148. Never give up. And now whatever chance you have, whatever time you have, now you do your best and things will make sense. I'm telling you, it will make sense by the end of the journey. Exam entrance question number one: severe acute malnutrition. How do you define severe acute malnutrition? Very, very important. Severe acute malnutrition. If I stress on this word acute malnutrition, can you tell me in the comment section, are we talking about the wasting or are we talking about the stunting? What do you think, guys? Severe acute malnutrition. Abhishek Kumar says we are talking about stunting. सामने होता तो वहां के मारता, लेकिन that is known as wasting. Acute malnutrition is known as wasting, whereas chronic malnutrition, that is known as stunting. That is the first question for exam. I'll repeat again. The topic of choice we have is a severe acute malnutrition. When the baby is acutely malnourished, his weight is, the weight goes down, and that is known as wasting. When someone is chronically malnourished, the thing that what goes down is my height. The parameter affected in acute malnutrition is decreased weight for height, whereas parameter affected in chronic malnutrition is height for age. Height for age. So weight for height and height for age. The parameter affected in acute malnutrition is weight for height, and parameter affected in chronic malnutrition is weight for age. And weight for height less than -3 standard deviation. Please note, weight for height less than -3 standard deviation, star mark. This is an exam question. Okay. So SAM is defined as weight for height less than -3 standard deviation. MUAC, mid upper arm circumference, less than how much? The answer is 11.5, or with or without edema. If the patient is having with edema, we're gonna call him Kwashiorkor. If it is without edema, we're gonna call him marasmus. Please remember, marasmus is deficiency of calories. Marasmus is deficiency of calories, whereas Kwashiorkor is deficiency of proteins and calories. Kwashiorkor is deficiency of proteins and calories. Please remember that. Marasmus is deficiency of calories, and Kwashiorkor is deficiency of proteins plus calories. Yes, Brij Bhan Singh Yadav, anything you want to ask? Done. Next question. Marasmus baby. Marasmus baby लगते सूखे हैं, but they have voracious appetite. Yes, my dear Prakash, voracious appetite का मतलब होता है बहुत ज्यादा खाते हैं. ये लगते बहुत पतले हैं. Marasmus baby, if you look, no, they look so skinny. They look so skinny, but they have voracious appetite. They eat a lot. Whereas at the same time, Kwashiorkor baby, they are so fatty. They have NSAR, no, but they have apathy. They look very fatty, पर ये कुछ नहीं खाते. Very importantly, they look very fatty, but they don't eat a lot. ओपनहाइमर कह रहा है फिर जहां कहाँ फिर जाता कहाँ है उनका उनका तिलंडे में चला जाता है. ठीक है. So marasmus baby look very skinny, but they have voracious appetite. Kwashiorkor baby look very fatty, but they have apathy. नयन, लेटेस्ट गाइडलाइंस के हिसाब से marasmus is deficiency of calories and Kwashiorkor is deficiency of protein plus calories according to the latest guideline. Silanda नहीं tilanda, मतलब that's just a slang. Next one, theory of adaptation. Which one follow the theory of adaptation? Is it marasmus or Kwashiorkor? So I don't get to eat, I go thin. I don't get to it, I go thin. So means the marasmus baby, they follow the theory of adaptation. उनको खाने नहीं मिला, वो हो गए पतले. Whereas Kwashiorkor baby also did not get anything to eat, but they got fatty, right? So that means they follow the theory of disadaptation. So Kwashiorkor follow the theory of disadaptation and marasmus follow the theory of adaptation. What are the liver findings in Kwashiorkor? Kwashiorkor is the fatty baby, so you see a fatty liver, whereas marasmus is the a skinny baby, so you will see atrophic liver. Atrophic liver, perfect. Next question, what is the hypoglycemia cutoff in the case of SAM? Remember 45 and 54. 45 and 55, nahi, 45 and 54. Less than 45 sugar is hypoglycemia cutoff in SAM, whereas newborn baby hypoglycemia cutoff is sugar less than 45. Sugar less than 45. When do we give iron in a case of SAM? In a case of SAM, basically there is something known as, we have something known as stabilization phase and something known as rehabilitation phase. Stabilization phase and rehabilitation phase. Stabilization phase and rehabilitation phase. The beginning 7 days of admission is a stabilization phase where you stabilize the patient, and then you have the rehabilitation. So remember, iron is always given very importantly in the rehabilitation phase. Yes, after one, yeah, Sonam is very right. After 1 week, पहले बच्चे सिंपल मोटा मोटा शब्दों में बच्चा आया है, पहले स्टेबलाइज करो फिर दवाई दो. You stabilize the patient first and then give the iron. So iron is given in the rehabilitation phase. What is the dose of vitamin A in the iron is always an exam question. So vitamin A less than 6 months baby, how much you give? 50,000 international units. So less than 6 months baby, you give 50,000 IU. 6 months to 1 year baby, you give 1 lakh IU. Okay. And more than 1 year old baby, you give 2 lakh IU. So that is the dose of vitamin A. Less than 6 months baby, you give 50,000 IU. 6 months to 1 year baby, you give 1 lakh IU. And more than 1 year baby, you give 2 lakh international units. Yes, yes, Pandey, you're very, very right. And vitamin K कितना देते हैं? Vitamin K we give 2.5 milligram. As in the Sam baby, we give 2.5 milligram vitamin K. Sam baby. Sam baby, remember 6 months to 5 years के बीच होता है. Normally, Sam baby we give 6 months to 5 years के बीच होता है. Very importantly, yes, वो कह रहा है सर ब्रिजभान को विटामिन ए देना, जरूर उसको बुलाओ, उसे पिलाएंगे. If I talk about vitamin K in a newborn baby with vitamin K, the dose is 1 milligram. Newborn baby vitamin K dose is 1 milligram, and Sam baby vitamin K dose is 2.5 milligram. Last question they ask in exam about the Shakir tape. So everyone knows about the Shakir tape. So this color, this is basically Shakir tape. Shakir tape has how many colors? It has red, yellow, green. Red, yellow, green. Shakir tape, yes, you're right. Smiley is right. For the mid upper arm circumference of the baby, we use Shakir tape. If the mid upper arm circumference is less than 11.5 centimeter, means the baby is coming under red color tape. Less than 12.5 centimeter means the baby is in yellow color, and more than 12.5 centimeter means the baby is in green color Shakir tape. Remember, so red, yellow, green, red, yellow, green. Okay, so less than 11.5, less than 12.5, and more than 12.5. Yeah, this is yes, my dear Shub, this is according to the WHO. Then we have Sam with dehydration without shock. Someone is dehydrated but not in shock, then you will give ORS. Okay. Yes, breastfeeding and ORS, or ORS and breastfeeding. Yes, we can give. Someone is dehydrated and someone is in shock, then the answer will be normal saline with 5% dextrose or linger lactate with 5% dextrose. Remember that. If someone basically in the Sam with dehydration with shock. Yes, exactly. Yeah. Yes, you're very right. You're very true. Okay, I'll repeat again. Sam with dehydration without shock, you give ORS. And Sam with dehydration with shock, you give ringer lactate with 5% dextrose or normal saline with 5% dextrose. Remember that. Yes. Yeah. You're very right. I agree with you. Sam baby with dehydration without shock, yes. Normal patient you use ORS, very true, very logical point. But Sam baby में हम क्या देते हैं? Risomal, very true, Risomal. What is the meaning of Risomal? Any idea? What is the full form of Risomal? Re for rehydration. मतलब सैम बच्चों का ओआरएस पैकेट, एक होता है नॉर्मल ओआरएस पैकेट, एक होता है सैम बच्चों का ओआरएस पैकेट. रिसोमाल इज रिहाइड्रेशन सॉल्यूशन of the malnourished. Rehydration solution of the malnourished, that is known as Risomal. So that's very well put actually, that Sam baby with dehydration without shock, yes, that is what you call Risomal. And Sam baby with dehydration with shock, that is very importantly NS with 5% extra. Here only, if you want to cover Risomal in the normal ORS packet, if you talk about the normal ORS, can you tell me how much is sodium in ORS? Any guesses? How much is sodium in ORS? Any guesses? Sodium in normal ORS is 75. ये 70 कौन बोला मरने के लिए, कौन तैयार है? Yes. कुछ और भी होता है क्या? 75. Something else also 75 is there. Glucose. Yes, Pulkit, you're very right. Glucose is 75. Sodium 75, glucose 75, potassium is 20, citrate is 10, and chloride is 65. We have to clear this exam, okay? Very, very important. Headache will come, tiredness will come, but imagine little bit if you left out, again, you are failing. Just imagine if you get this time also 149. Do you really want 149? No, right? Then you have to work hard. फीलिंग टायर्ड, नो प्रॉब्लम, नींद बहुत आती है, एक बकेट पानी का बाल्टी का बकेट रखो बगल में कमरे के बीच के अंदर, नींद आए तो मुंह घुसा दो उसके अंदर, फिर नींद उठ चली जाएगी. सो इन द नॉर्मल ORS पैकेट सोडियम इज 75 मिली ऑस्मोल्स पर लीटर, ग्लूकोज 75, पोटेशियम 20, citrate 10 and chloride is 65. Next, in Risomal, in Risomal, two things you have to remember: potassium is double, potassium is 40 in Risomal, and sodium is 45 in Risomal. Potassium is doubled and sodium is half. Star mark exam question, star mark exam question. Has that finishes the whole topic of severe acute malnutrition? Has everyone understood? Yes or yes, yes? 1 hour more, then the class is over. Almost 3 hours are soon coming to an end. It was a 4 hours session. Yes. मिड अपर आर्म सर्कमफ्रेंस में जो मैंने बताया है, लेस देन 11.5 इज रेड कलर, लेस देन 12.5 इज येलो कलर, एंड मोर देन 12.5 इज ग्रीन कलर. इसको पत्थर की लकीर के तरह ताबीज बना के अपनी बाजू में बांध के रखें, काम आएगी. ठीक है. विटामिन के का डोज, विटामिन के इन अ न्यूबॉर्न बेबी, in a newborn baby the dose of vitamin K is 1 milligram, whereas severe acute malnutrition baby the dose is 2.5 milligram. A quick 1 minute break, then we're gonna start again. 45-40. Just remember one more thing, my bro, that normal ORS potassium is 20, whereas Risomal potassium is double 40. Normal ORS sodium is 75 and Risomal sodium is half. Sodium is 45. So sodium is half and potassium is doubled. That's what you need to know. Okay. Last 1 minute left. Has everyone understood? Let's chit chat. ये और क्या चल रहा है लाइफ में? कितनी पढ़ाई होगी? क्या करना है आगे लाइफ में? कितना पढ़ोगे यार? आता तो है सारा तुमको, छोड़ो कहानी. Let's just close the books and let's just fly off weekend some. Let's just go out somewhere, no? iPad Pro आगे never happen या ओह ओह, अच्छा पहले ही अजाम के वो बता दिए आंसर्स. यस. यस. नीचे वाला, हाँ नीचे वाले बच्चे आंसर दे देंगे, बच्चे ऊत में बैठे हैं पहले ही आंसर दे देंगे सारे के सारे. Yes, yes. 10 seconds more. Yes, then we're gonna have nice this one. We're gonna start again. समय खत्म होने वाला है, कुछ कुछ करें. एक शायरी भी सुनाता हूँ, शायरी. दुश्मनों को यही खल रहा है, दुश्मनों को यही खल रहा है कि तूफानों में भी हमारा दिया क्यों जल रहा है. दुश्मनों को भी यही खल रहा है कि तूफानों में भी हमारा दिया क्यों जल रहा है. लग जा गले, लग जा गले मुझे बहुत अच्छे से नहीं आता है ब्रो, थोड़ा थोड़ा ही आता है वो वाला तो. यस. बातें ये कभी ना. Last 5 seconds, we're gonna start again. This chapter is coming to an end. One more PDF is still waiting for us. Yes, 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 yes. Page number 10. Okay. Yeah. Okay, nice. Last 5 seconds. Okay, गाना गाएं. Okay, okay, okay. How to tackle part 1, how and part 2. सब हो जाएगा. Just make sure. So one important advice to everyone. Just on the day of exam, first of all, please have a good breakfast and go. Don't skip breakfast. Have, दही खा के जाओ, पेरेंट्स के पैर छू के जाओ, मंदिर होके जाओ. Number 1. Number 2, just before the exam, once you open the main sheet, please, 5 deep inspiratory and deep expiratory breaths are must. Like complete inhale, 1, 2, 3, 4, 5, speaking in the mind. Complete exhale slowly, 1, 2, 3, 4, 5, exhale at least 10 times, minimum 10 times you should do. Then open your eyes, open the paper, and do it. Your all the worriness will vanish away and you will do it. Okay, very important. Yeah. बातें ये कभी ना तू भूलना, कोई तेरे खातिर है जी रहा, जाए तू कहीं भी ये सोचना. Okay. Yes. Hello, everyone. The class is coming to an end. I hope you guys had a nice time. And neonatology is the topic of choice. Before starting any segment, we always have a quote, and the quote says, "Mistakes are a proof that you're trying." So do a lot of MCQs. Okay, do lot of MCQs. If you have any doubt, I'm saying any doubt. My mobile number is 9999897081. You can just WhatsApp me, and if you want to chit chat with me, no non-veg talks, only about studies. Okay, and that's it. We'll have fun. Next question. Exam entrance question number one. What is the normal heart rate of a newborn? Can you please answer in the comment section? The normal heart rate, ऐसा कुछ नहीं गुज्जर. The normal heart rate of a newborn is 120 to 160 beats per minute. Number one. What is the normal respiratory rate of a newborn? The answer is 40 to 60 per minute is the normal RR of a newborn. Do you see cyanosis in a newborn? The answer is yes, you can see cyanosis in a newborn, which is known as acrocyanosis. Acrocyanosis. Acro means periphery, cyanosis means cyanosis. I'll repeat again. Acrocyanosis, what I'm trying to say is acrocyanosis could be physiological also. Every cyanosis in a newborn is not a what you call congenital cyanotic heart disease. So a baby's peripheries can be blue, known as acrocyanosis, and it could be physiological. That's what you're trying to say. A baby passes stool within how many hours? Again, latest guidelines are changed. A baby passes stool within 48 hours and urine within 24 to 30 hours. If you still don't remember, just remember the baby passes urine and stool within 24 to 48 hours. That's it. Okay. The normal weight of a newborn we have already done, 2.5 to 4 kg. More than 4 kg, what will you think of? More than 4 kg is known as macrosomic baby. If the baby is macrosomic baby, what will you think of? The answer is infant of diabetic mother. Infant of diabetic mother. So, which is the most common congenital heart disease in infant of diabetic mother? The most common congenital heart, देखो ये एक और आ गया अरिंदन सर. पीसीएम सर सेज 2.8 होता है. जो बड़े पापा बता रहे हैं बस इसको सुन लो. 3 kg एवरेज इंडियन टू 3 kg, बस बात खत्म हो जाती है वहां पे. कंफ्यूजन नहीं पालनी. The most common congenital heart disease in infant of diabetic mother is a ventricular septal defect. The most common congenital heart disease in infant of diabetic mother is a VSD. Whereas, which is the most specific congenital heart in infant of diabetic mother? Most specific congenital heart in infant of diabetic mother is a TGA. I'll repeat again. The most common congenital heart disease in infant of diabetic mother is a VSD, whereas the most specific congenital heart disease in infant of diabetic mother is a TGA. What's the X-ray finding of TGA? Could you answer in the comment section? X-ray finding of TGA is ande pe dhaga, egg on string appearance. The X-ray finding of TGA is egg on string appearance. Where do you see figure of 3 appearance? We have done that. The answer was coarctation of aorta. Where have you seen box-shaped heart? The answer was Epstein anomaly. Where have you seen boot-shaped heart? The answer was tetralogy of Fallot. And where have you seen figure of 8 appearance? The answer was supracardiac TAPVC. In a case of supracardiac TAPVC, you will see figure of 8 appearance. Remember that. Very good. Low birth weight we have done, that is less than 2.5 kg. Very low birth weight is less than 1.5 kg, and extremely low birth weight is less than 1 kg. We have done that. What is CFT? CFT is capillary filling time. Just right now the name you should know. CFT is capillary filling time, which is usually less than 3 seconds. Capillary filling time, which is usually less than 3 seconds. Very good. What is the normal length of the umbilical cord? Remember, what is the normal length of a newborn? The normal length of a newborn was 50 centimeter, right? So here also same, only 50 centimeter. The normal length of the umbilical cord also is 50 centimeter. The normal length of newborn also is 50 centimeter. What's the normal blood pressure of a newborn? What is adult blood pressure? Adult blood pressure is 120 by 80. Half of 120 is 60 and half of 80 is 40. So normal blood pressure of a newborn baby is 60 by 40. What is the normal blood volume in a newborn? The blood volume in a term baby is 60 to 80 ml per kg, whereas in a preterm baby is 90 to 110 ml per kg. Vitamin K. What is the dose of vitamin K in a newborn? We have done that. That is 1 mg. And why do we give vitamin K to a newborn? If I ask you an extra question, देते क्यों है vitamin K newborn में? Because breast milk is deficient in vitamin K. Breast milk is deficient in vitamin K. No, that's why we give vitamin K to a newborn. And one more thing also, newborn liver का क्या काम क्या होता है? What is the function of liver? Newborn's liver, it makes vitamin K dependent clotting factors. I'll repeat again. Normally, newborn's liver forms vitamin K dependent clotting factors, and vitamin K is helping in that. Vitamin K, if you give vitamin K to a newborn, so vitamin K dependent clotting factors will be made. And what are the vitamin K dependent clotting factors? 2, 7, 9, 10. Already everyone answered. Perfect. You will get marks, no doubt. It's a pre PYQ hai. Vitamin D. Why do you give vitamin D to a newborn? Because breast milk is deficient in vitamin D. That's why we give. Very good, Abhishek. What is the dose of vitamin D? 400 international units in term baby till 1 year. Vitamin K is injection, 1 mg, single dose. Vitamin D is syrup, 400 IU every day for 1 year of life, till 1 year. That's what. समझ में आया? This part is important, my dear friends. I hope you got it. Great. Very good, very good, very good. Perfect. Next question, please. If the mother is hepatitis B positive, how do you approach the baby? Prakash, 400 IU every day. One dose, like 400 IU once a day, every day for 1 year. Okay? If the mother is Hep B positive, how do you approach this case? If the mother is Hep B positive, yes, Akash Gupta. If the mother is Hep B positive, बच्चे में क्या करोगे? The baby will be given hepatitis B immunoglobulin plus hepatitis B vaccine. Okay, remember, if the mother is Hep B positive, the bacha on one thigh, he will be given hepatitis B immunoglobulin, whereas on the other thigh, he'll be given hepatitis B vaccine. Hepatitis B vaccine, remember that, okay? Number one. Number two, acha, one more thing. If I ask you routinely, what do you give at birth? Can you tell me routinely what do you give at birth? Routinely at birth, we give BCG, OPV, and Hep B. We have done that, no? BCG, OPV, and Hep B are given at birth. If the mother is Hep B positive, then along with Hep B vaccine, you will give Hep B immunoglobulin. Very good. One more thing. If I ask you what is the schedule of Hep B vaccine, that was the exam question. What is the schedule? कब देते हैं hepatitis B का vaccine? When all do you give hepatitis B vaccine? You will give at birth, you will give at 6 weeks, and you will give at 6 months. Star mark PYQ FMG. Birth, 6 weeks, and 6 months. Remember that, okay? And what about MMR? When do you give MMR? Again, a PYQ FMG. Nowadays, we don't give MMR, we give MR1 and MR2. Mums, we are not giving nowadays. It's MR1 and MR2. MR1 is given at 9 months, MR2 is given at 15 months. There was a FMG question कि measles का outbreak आ गया एक. Measles का, there's a measles outbreak, and someone MR1, they came at 7 months of life and got it done. Okay, some family came at 7 months of life. Early they came because they got a call that measles ka outbreak has come. Please come and get your vaccinated very fast. Then when is the second dose of this one will be given? The answer will be 12 months. 12 months. ASAP usually 12 हफ्ते वो होता ना, between two vaccine you should have a gap of 4 weeks, right? अच्छा हाँ, months है ना, पर ये तो चलो ठीक है. 7 months and 12 months, remember. Normally the first dose of MR1 is at 9 months, second one dose at 15 months. Whereas in the measles outbreak, if one dose is at 7 months, then second dose will be at 12 months. Remember. Done. Next question. If the mother, okay, let's do the easy ones. If the mother is approached to a TB positive mother, if the mother is TB positive, what the child will be given? Any idea? If the mother is TB positive, what the child will be given? If the mother is TB positive, what do you give in the baby? If the mother is TB positive, 1 second, कहाँ चला गया? Yes, 1 second, इसका कुछ अड़ गया इसमें. कोई तो मैंने उंगली करी है. So कोई नहीं. हाँ. If the mother is what you called, I hope the screen is visible, no? Okay. Hmm. If the mother is TB positive, yes, Smiley is right. The baby will be given isoniazid at the rate of 10 mg per kg per day for 6 months. The baby is given isoniazid at the rate of 10 mg per kg per day for 6 months. If the mother is TB positive, okay, done. Which is the most common TB in children? Any idea? The most common TB in children? Any random guesses? Yes, yeah, pulmonary TB. The most common TB is the chest wala TB, छाती का TB. The most common TB in children is pulmonary TB, and the most common extrapulmonary TB in children is the lymph node TB. Lymph node TB. Okay, lymph node TB. हाँ, ये नयन ने लास्ट क्वेश्चन पूछा था. हाँ, यस माय डियर नयन भंडारी, आप लास्ट क्वेश्चन तुमने यही पूछा था कि उधर तो ये बताया था, आपने ये बताया. नॉर्मली हेपेटाइटिस बी का पहले ना 6, 10, 14 देते थे, और हम बर्थ पे, अब जो है हम बर्थ पे देते हैं, 6 वीक्स पे देते हैं, और 6 मंथ्स पे देते हैं. तुम बस भगवान से प्रार्थना करो कि ये क्वेश्चन ना आ जाए एग्जाम में. ठीक है. नेक्स्ट क्वेश्चन प्लीज. The next question we have is, which is the most common type of TB in children? The most common type of TB in children is pulmonary TB. And which is the most common extra pulmonary type of TB? Lymph node. कोई भी lymph node. Could be abdominal lymph nodes, could be any lymph nodes. Remember that, okay? That is done. बीसीजी क्यों लगाते हैं? बीसीजी हमें किससे बचाता है? बीसीजी प्रिवेंट्स फ्रॉम व्हाट? BCG vaccine basically prevents from extra pulmonary TB. Okay, my batchmate, she had told BCG vaccine prevents us from pulmonary TB. Then the examiner had failed her and she came after 6 months. BCG vaccine basically हमको extra pulmonary TB, or I would say disseminated TB, or I would say CNS TB, like tubercular meningitis, like abdominal TB, like TB spine, extra pulmonary TB से बचाता है. Very important. Now, this is such a crucial question. Approach to a HIV positive mother. Okay. So approach to, I need a separate page for that. Yeah, this one. So if the mother is HIV positive, how do you approach this case? Can you please answer in the comment? If the mother is HIV positive, how will you approach? So if the mother is HIV positive, point number one, whether she has taken the ART or not, whether she has taken the ART or she has not taken the ART, or you can say ART sufficiently she has taken or not taken, and that will be like if she has taken the more than 4 weeks of therapy, bole to sufficiently she has taken. Less than 4 weeks of therapy means insufficiently she has taken. Yes, she has taken the ART sufficiently. Then the baby will be given nevirapine for 6 weeks. Yes, the baby will be given nevirapine for 6 weeks if she has taken the ART sufficiently. If she has not taken the ART sufficiently, then it depends whether she's coming into the low risk of transmission or she's coming into the high risk of transmission. Whether she's coming into the low risk of transmission or high risk of transmission. If she's coming in the low risk of transmission, you're gonna give nevirapine for 12 weeks. And if she's coming in the high risk of transmission, you're gonna give nevirapine plus zidovudin for 12 weeks. Nevirapine plus zidovudin for 12 weeks. I'll repeat again. In this beautiful slide, I've got an idea. If the mother is HIV positive, you have to give something to the baby. But now it depends whether she has taken the ART or not. If she has taken the ART sufficiently, then only never happens for 6 weeks. And if she has not taken the ART sufficiently, then it depends whether she's coming into the low risk of transmission or high risk of transmission. If she's coming in the low risk of transmission, you will give only nevirapine for only 12 weeks. Whereas if she's coming in the high risk of transmission, you will give nevirapine plus zidovudin for 12 weeks. Nutan says, will we continue breastfeeding, sir? Yes, my dear, we will. Mother HIV positive, TB positive, COVID positive, this positive, that positive, you will give breastfeeding. Never, ever, ever stop breastfeeding in India. Yes. Except, yes, Abhishek Kumar Pandey beautifully said, except galactosemia, lactose intolerance, or mother on chemo radiotherapy. Has everyone understood? Yes or yes, yes? Last 1 hour, and we have the next PDF set with ready with us. Dr. Enthusiastic says ये low risk और high risk कैसे पता चलता है? By the viral load. We get to know by the viral load actually. Before starting any segment, we have this very nice quote: "People who hate me, people who hate me motivate me. People who hate me motivate me." So life is beautiful, okay? Life is amazing. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. मस्त मस्त बढ़िया बढ़िया रह के जीना है और सब अच्छा होना है. वो कहते हैं ना कि हीरा अपनी चमक को तब पाता है. हीरा अपनी चमक को तब पाता है जब तराशा जाता है. सो हीरा अपनी चमक को तब पाता है जब तराशा जाता है. ठीक है. परफेक्ट. वेरी गुड. दैट्स द राइट आंसर. शुभ क्या कह रहा है? डू वी हैव द नेक्स्ट क्लास ऑफ पीडियाट्रिक्स और मैराथन? इतने में इतना ही मिलेगा. इतना ही था पीड्स का. ठीक है. लो रिस्क हाई रिस्क नहीं दिया फिर. हाँ तो कुछ फिर तो कुछ नहीं. फिर नेवर हैपन फॉर 6 वीक्स. बस एच आई जो इस साल क्वेश्चन आया था वो ये था कि मदर HIV पॉजिटिव है, बताओ बच्चे में क्या करोगे. द आंसर वाज व्हाट यू कॉल्ड कि नेवर हैपन देंगे. बस ऐसा करके. ठीक है. ठीक है. परफेक्ट. चलो जी. ठीक है. डन. ओके. नेक्स्ट क्वेश्चन प्लीज. ठीक है. इसका अगर कोई वो है तो मैं आपको इसका स्लाइड भेज दूंगा. इसका ना प्रोटोकॉल का एक पेज है वो भेज दूंगा. उसको पढ़ लेना अच्छे से. नेक्स्ट क्वेश्चन प्लीज. ओके. My question to you have is, how many of you are satisfied with your life? Can you please answer in the comment section? Are you satisfied with your life? Yes, 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 no, horribly no, very yes. Yes, so we have mixed reviews. We have Doctor who says yes, yes. We have Gujjar, we have Sawbones, Parvez, Omkar, Pulkit, Prakash, Prakash again, Kush, फिर प्रकाश पांड्या, कार्तिक देशमुख, वी हैव आकाश गुप्ता, विक्रम शिंदे एंड पांडे, अभिषेक, चिराग, प्रकाश, अनुज. बहुत सारे हैं. हाँ. सो आर यू हैप्पी विद योर लाइफ? द आंसर इज वेरी वेरी इंपॉर्टेंट. सो वी आर यू अ क्रो? So how many of you are a crow? Can you please raise your hands? Yes or yes, yes. So once upon a time, what happens? I told you the story. A crow, he went to God, okay, and he tell the God that I don't want to be a crow. I never want to be a crow. Crow is so dark. Crow is so not so good looking. Whenever I go to someone's house, people, flew me away. So I don't want to be a crow. Then he said, I want to be a parrot. Parrot is so nice, so beautiful, just looking like a wow. So, okay, fine. Then God said, okay, okay, fine. I will make you a parrot. No problem. Just go to parrot. If parrot says yes, no, I'll surely make you a parrot. Then this crow basically he went to the parrot, and parrot says to crow that whatever you want to become, you become, okay, bro, but never be a parrot. He's like, why? Why I should not be a parrot? Because he said that I am so beautiful, but the problem is people cut my feather and they put me in the cage just to have me in their houses. They put me in the cage. So कुछ भी बन जाना पर तोता मत बनना. Whatever you want to become, you become, but never be a parrot. Then crow and parrot, they both decided They went to God and they told God, हमको मोर बना दो. We want to be like a peacock. Peacock is the best. So beautiful, so elegant, just looking like a wow. Because people they fly places to look for the peacock, and in rainy season, peacock looks so beautiful and all. Then God, our God says, okay, fine, I'll make you a parrot. I'll make you a peacock. Just go to the peacock, and if peacock agrees, I'll make you a peacock. They all went to the peacock, and peacock says that whatever you want to become, you become, but never be a peacock. He is like, people come, the hunter comes, they kill me, and I have feathers, but still I can't fly. Girls, they pluck my feather and put in their notebooks, and whatever you want to become, you become, okay, but never be a peacock. So what happened? What is the moral of the story? What is the ending of the story? The ending of the story is the peacock and the parrot. The peacock and the parrot, they went to God and they said, we want to be like a crow. वो बोले कि हमको कौवा बना दो. कौवा सबसे बढ़िया. ना कोई कौवे को देखता, ना कौवे कोई कोई पूछता, ना कोई कौवे को कोई अपने घर पे बस वो रखता. We wanna be like a crow. So that's what. Okay, remember that. Next topic, please. Next topic, yes. Hmm. Okay, 1 second. I have to check whether it's coming or not. Okay, I'll ask again the last time. Is the slide visible to everyone? Yes or yes, yes. मेरे सामने वाले ठीक है, आवाज आ रही? Okay. Too much lagging, don't worry, it will come up now. Lot of slide shifting will happen. Okay, yeah. Last 60 minutes of your life, and we have extreme so many slides to cover. Just pray to God your internet keep working well. इसे पेन कैसे आता है? अच्छा ये रहा. 1 second. Yeah. So exam entrance question number 1, what is this slide? The answer is, it is a single bubble sign. And where do you see single bubble sign? The answer is congenital hypertrophic pyloric stenosis. And what is the name of the surgery for CHPS? Can anyone tell me? Beautiful answer by Newton, who says Ramstead pyloromyotomy. Ramstead pyloromyotomy. Okay, so I'll repeat again. The name of the surgery for CHPS is Ramstead pyloromyotomy. And mother would have taken which drug during pregnancy? The mother would have taken erythromycin during pregnancy. Number 1. Number 2, next question we have is, what is this? So we all know 1 and 2. So this looks like a double bubble sign. So where do you see double bubble sign? The answer is duodenal atresia. In duodenal atresia, do you see double bubble sign? And in which syndrome? Which syndrome is associated with duodenal atresia? Down syndrome. Down syndrome patient. Remember D, D, D. In Down syndrome, you have duodenal atresia and you see double bubble sign in that. Next question. What is this? 1, 2, and 3. So very importantly, this is a triple bubble sign. Triple bubble sign. Where do you see triple bubble sign? The answer is jejunal atresia. The answer is jejunal atresia. Very good. That's the right answer. Okay, in which syndrome, very importantly, the IQ will not be affected. So we know that in Turner syndrome, the IQ will not be affected, which is the most common congenital heart disease in Turner syndrome. The most common congenital heart disease in Turner syndrome is a bicuspid aortic valve. Bicuspid aortic valve, and the most common cause of death in Turner syndrome is coarctation of aorta. Okay, very important. Next question, please. Okay, yeah. Now this is good question. What are the method for antenatal screening for Down syndrome? The method for antenatal screening for Down syndrome, we have the first trimester markers and we have the second trimester markers. In the first trimester, we have the dual marker, whereas in second trimester, we have the triple marker as well as we have the quadruple marker. What is there in the dual marker? Any idea? In dual marker, you have beta HCG and PAPA, beta HCG and PAPA, and also very important, we have this sonography which shows the knuckle thickness. कितना cut off होना चाहिए knuckle thickness का? Newton? Yes, very good, my dear. Knuckle thickness more than 3 millimeter. So very important. Okay, so this part is done. I'll repeat again. In this beautiful slide, I've got an idea that in the antenatal screening for Down syndrome in the first trimester, you have the very importantly first trimester, we have the dual marker. In that you have the beta HCG and PAPA, and what you called ultrasonographically knuckle thickness more than 3 mm is significant for Down syndrome. Okay. And in second trimester scan, we have the triple scan and quadruple scan. What is there in the triple scan? Any idea? We have the alpha fetoprotein, we have beta HCG and estriol. So alpha fetoprotein, beta HCG, and estriol are there in the what you call the triple marker. And what is there in the quadruple marker? Any idea? In the quadruple, you have very importantly inhibin A. Inhibin A is there in the quadruple scan. Very crucial exam. It's a gynae plus pediatrics topic and it's covered well. So these are the questions they ask in exam. Please remember that. Look at the question and what is your best answer. In the first trimester screening for Down syndrome, which of the following tests is to be done? What do you think, guys? A, B, C, D. Any guesses? What the best answer coming? So I think the first trimester screening, basically beta, HCG, and PAPA sounds a very good answer. Very good. This part is done. 1 second. I have to shuffle the pages. Yeah. Now this is a very important slide. Okay. This is a very important slide. Exactly. कौन सा बढ़ेगा? हाँ जी, माय डियर प्रकाश, वही बता रहा हूँ करके, है ना? या सो क्योंकि अब आई हैव टू शिफ्ट द स्क्रीन, से मैं क्या करूँ, क्योंकि वी हैव लॉट ऑफ स्लाइड, सो आई हैव टू गो टू द नेक्स्ट स्लाइड. आई कांट डू एनीथिंग इन दैट, है ना? अच्छा, नाउ दिस इज इंपॉर्टेंट. रिमेंबर डाउन सिंड्रोम. Down syndrome patient, very importantly, the mnemonic we have is high. Down syndrome patient, the mnemonic is high. So H and I are high in a case of Down syndrome. H for beta HCG and I for inhibin A, they are high in a case of Down syndrome. Whereas in a case of Turner syndrome, also same story, the mnemonic is high. H and I are high in a case of Turner syndrome also. Whereas Edwards syndrome, the patient has a rocker bottom feet. Edwards syndrome, the patient has a rocker bottom feet. So his feet is like a rocker bottom, so he will be slow. So basically H and E are low. H for beta HCG and E for estriol are low in a case of Edwards syndrome. P for Patau, P for alpha fetoprotein. P for Patau, P for alpha fetoprotein, and that is basically increase in a case of Patau syndrome. Alpha fetoprotein is increased in a case of Patau syndrome. Yeah, that's what. So this part is done, that you should know. Next question, please. I hope you guys have the PDF file with you. No, last night only I shared the PDF file with you, this one, and you can just scroll that one and keep talking about it. That will be easy actually. If you don't have it, you have my mobile number. I'll share it with you. Okay, what is this? We all have done that. So this patient basically has an absent clavicle. This patient is able to touch her own shoulders. Absent clavicle. So this is a case of cleidocranial dysostosis. This is a case of cleidocranial dysostosis where the patient has, very importantly, absent clavicle. Take it, done. Next question, please. Yeah, very nice. What is this picture? Now this picture is a case of heterochroma iris. Yes, hetero means different, chroma means color, and iris means the colored part of the eye. There's a difference in the color part of the eyes in this patient. And very importantly, what are we talking about in this case? Which syndrome are we talking about? रिमेंबर हॉस्टल का वार्डन, यस डॉक्टर अनुज, हॉस्टल का वार्डन कैसा होता है? द आंसर इज वार्डनबर्ग। वेरी गुड प्रकाश, वार्डनबर्ग सिंड्रोम। हॉस्टल का वार्डन कैसा होता है? हाउ इज हॉस्टल वार्डन? नंबर वन, ही कैन नॉट सी प्रॉपरली। व्हाई? बिकॉज ही हैज हेटेरोक्रोमा iris. Number two, he cannot hear properly. He has hearing loss. And number three, he has a white bunch of hair. He has a white bunch of hair. And that basically is known as P. baldism. P. baldism. The triad, the triad of Waardenburg syndrome is very importantly uh, heterochroma iris, P. baldism, and what do you called? क्या था और क्या था? Hearing loss. Yes. प्रकाश कह रहा है ये तो हॉस्टल की अच्छी वार्डन है। तुम्हें बड़ा पता है, तुमने बड़ी वो कर रखे हैं हिसाब किताब अपने यूक्रेन में। यूक्रेन में कहते हैं कि सबकी वो इंटरनेशनल गर्लफ्रेंड होती हैं, इंडियन कोई गर्लफ्रेंड नहीं लेता, ऐसे क्यों? जितेंद्र कह रहा है आज थाई था। तुम्हें कैसे पता कि आज थाई था मेरा जिम में? So this girl, very importantly, so this also nice case. So we have this what you call 9-year-old girl. Yes, 9-year-old girl came with the complaints of, now this was a video. I hope you guys have. Should I show you the video? I hope, have you seen this video of this patient, or should I show you? If you have seen, fair enough. If you have not seen, okay, then fine. So it means you've already seen. Perfect. So this patient basically, we tell her to blow the paper, and what you called, once we tell her to blow the paper, and she basically, very importantly, go into a state of absence seizure. There are a lot of students who are saying, we have not seen it, please show us. Showing you, just 1 second. Okay, so this is important, 1 second. क्योंकि अगर if one also have not seen, it's our duty to show them. Okay, so it's important. Oh should 1 second. Where is the one day touch one? So this patient had come in this one. They ask in exam what this patient. Yet every year this question has come. Okay, because naturally this is an important case. That's why it has come. Okay, uh, uh, yeah. Just quickly have a glance. 1 second.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 7, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48। क्या नाम है बेटा? क्या नाम है? बताओ क्या नाम है? क्या नाम है आपका? आपका नाम बताओ। क्या नाम है? क्या नाम है आपका?
ठीक है, I hope are you able to watch the video, everyone. So this was a like it's a random question. A 9-year-old patient came with complaints of, your child is not attentive in the classes. Doctor, your child is not attentive in the classes. Number one, the child has a staring look. Your child stares at people in the classes, have a staring look. What do you think exactly? ये क्या पांडे क्या बोला इसने? सो पांडे हैज अ डाउट, ही सेज भाई इतना करने के बाद तो मुझे भी आ जाएगा सीजर। yeah, it can happen after 45. So this is a case of absence seizures. Exam number 1. Exam entrance question number 2, what is the drug of choice? Now for everything, the drug of choice is sodium valproate. Before it was ethosuximide followed by sodium valproate, but now it is, you can say, sodium valproate. Okay, so it's a case of absence seizure. The child is not attentive in the classes, has a staring look and all that. So that's what you should know. Okay, very good. Perfect. Next question, please. Okay, the next question we have is this one. Yes, exactly. What do you see this condition? Where do you see that? Very simple. What is this? So we all know about it. So this is nothing but a case of, we all know it's a case of Wilson disease. Exam entrance question number 1. What is the gene mutation you have in Wilson disease? ATP 7B. Okay. And where do you see ATP 7A gene mutation? The answer is Menkes disease. What happened in Wilson? Copper everywhere. Everything copper increases. Okay. Serum copper, everything increases. What decreases in a case of Wilson is an exam question. The answer is serum ceruloplasmin level. Serum ceruloplasmin levels decreases, but rest basically increases in a case of Wilson disease. Okay, serum ceruloplasmin level decreases, rest everything increases. What's the treatment for this condition? What do you want to give? You want to give zinc chelator. Something, I mean, as in you want to give chelation therapy, chelator, जो body में copper को लेके बाहर फेंके. So zinc is a very good chelator. You can give trientine you can give, or also you can give d-penicillamine. Zinc, trientine, and d-penicillamine. That's what three things you can give in a case of what you call Wilson disease, because all these are chelators. They take out what you called copper from the body. That you should know. Okay, this part is done. Yes. Where do you see champagne glass pelvis? The next question we have is, where do you see champagne glass pelvis? Champagne glass pelvis you see in achondroplasia. Achondroplasia, very importantly, what about the upper segment, lower segment ratio? Is it increase or decrease in achondroplasia? Remember, rickets, hypothyroidism, and achondroplasia, you have increased upper segment, lower segment ratio. What is the inheritance of this condition? A for achondroplasia, A for autosomal dominant. A for achondroplasia, A for autosomal dominant inheritance is seen in achondroplasia. So this patient, basically, his name is Tyrion Lannister, and that's what, yeah, this patient is Tyrion Lannister. प्रकाश, विल्म्स ट्यूमर तो दूसरे वाला है, वो बेकविथ वाइडमैन सिंड्रोम, डेनी ट्रैश सिंड्रोम और वैगर सिंड्रोम में होता है विल्म्स ट्यूमर. ठीक है, एग्जैक्टली, याद रखना. ठीक है, नेक्स्ट क्वेश्चन वी हैव इज, वेयर डू यू सी दिस coiled spring sign? Yes, where do you see coiled spring sign? Coiled spring sign, very importantly, you see in a case of intersusception. Coiled string sign you see in a case of intersusception. What is the triad of intersusception? The patient will have pain abdomen, the patient will have palpable mass, pain abdomen, palpable mass, and red currant jelly stool. Pain abdomen, palpable mass, and red currant jelly stool is the triad of interception. And X-ray may you see claw sign, claw sign or coiled spring. Like this picture is coiled spring sign, and you can see claw sign also. Yeah, which कौन ये इतनी अच्छी बात है कौन बता रहा है? Yes, Prakash Pandya is telling the very good answer. Prakash says, if there's a history of rotavirus, like which vaccine is contraindicated if you have a history of interception? Rotavirus vaccine is contraindicated if you have a history of intersusception. Very good, that's the right answer. A 5-year-old girl came with complaints of widening of wrist. A 5-year-old girl came with complaints of widening of wrist. Oppenheimer's ask why, बस होता है ऐसा, याद रखना. A 5-year-old came with complaints of widening of wrist. If I give you a more logical answer, 5-year-old came with complaints of bowing of legs and widening of wrist. So same story. The story goes towards rickets. Rickets is a disease of growing bone. Please note, rickets is a disease of growing bones. Remember that, okay? Rickets is a disease of growing bone. And what's the X-ray finding do you see in a case of rickets? The X-ray finding you see in a case of rickets, very important, is this one. Now this is the exam question. Very importantly, there is something known as cupping, fraying, and splaying appearance. There's something known as cupping, fraying, and splaying appearance you see in a case of rickets. These three are exam questions, okay? Cupping, fraying, and splaying appearance you see in a case of rickets. There was a student in my Bangalore class. I asked him, what do you see in rickets? He said Wimberger sign. He said, I see Wimberger sign in case of rickets. Can you tell me, where do you see Wimberger sign, or where do you see white line of Frankel? So Wimberger sign and white line of Frankel you see in a case of scurvy. Wimberger sign and white line of Frankel you see in scurvy, and cupping, fraying, and splaying appearance you see in a case of rickets. That you should know. Perfect. Next question. Where do you see hair on end appearance? Where do you see hair on end appearance, or where do you see crew cut appearance? The answer is thalassemia. in a case of thalassemia, or you can say in a case of sickle cell anemia. Thalassemia and sickle cell anemia, what do you see? The answer is very importantly, क्या बोलते हैं उसको, ये क्या बताया मैंने, hair on end appearance or cut appearance, very very important, remember that. Where do you see puff of smoke appearance? Puff of smoke appearance you see in moya moya, M-O-I-A, moya, M-O-Y-A, moya, M-O-Y-A, moya. So in the case of moya moya disease, you will see puff of smoke appearance. Very good. कितने ये अच्छे जवाब कौन दे रहा है? अच्छा, बहुत सारे लोग दे रहे हैं तो अच्छा. So puff of smoke appearance, very importantly, you see in a case of moya moya disease, that you should know. Next question, please. Yes, ये तो हर साल आता है. So what is this? This is nothing but, very importantly, Bitot spots. In which vitamin deficiency you see Bitot spots? The answer is vitamin A deficiency. In which classification of vitamin A deficiency you see Bitot spots? X1B. ये कौन बोला X2B? बच गया, वो भी नाम चला गया ऊपर. X1B. How will I remember? B for Bitot spots, B for X1B classification. Which is the earliest symptom and which is the earliest sign of vitamin A deficiency? Any idea? What is symptom? What is sign? मेरे को पेट में दर्द है. I have pain abdomen. Is it a symptom or a sign? It's a symptom. Or you found hepatomegaly. Is it a symptom? Hepatomegaly is a symptom or a sign? Hepatomegaly is a sign. So earliest symptom is night blindness. मेरे को दिखता नहीं है. I'm not able to see in the night. This night blindness is the earliest symptom. An earliest sign is conjunctival cirrhosis. Earliest sign is conjunctival cirrhosis. Remember that, okay? This part is done. Next question. This part is done. Yes, history of blue sclera with recurrent fracture. If I ask you this question, history of blue sclera with recurrent fracture, what will you write in exam? So history of blue sclera with recurrent fracture, very importantly, you will write osteogenesis imperfecta. What is the other name of osteogenesis imperfecta? You have brittle bone disease. The patient will have blue sclera, recurrent fracture, and deafness. The triad you have is blue sclera, recurrent fracture, and deafness is the triad for osteogenesis imperfecta. Okay. And what's in the treatment? What do you give? You give biphosphonates. In the treatment, you give biphosphonates. That we have is this pamidronate, elpradronate, all that. So biphosphonates is what you give in a case of osteogenesis imperfecta. Okay, this part is done. Next question. The patient, now this one, again, it was a video actually, but we have a 5-year-old baby came with complaints of not able to get up. He's not able to get up from sitting position. And what was the sign this patient will be showing? Any idea? The patient will be showing Gover sign. Exam entrance question number 1, where do you see Gover sign? In various muscular dystrophy. You see Gover sign in various muscular dystrophy, like you have is Duchenne muscular dystrophy. We have Becker's muscular dystrophy. So in both you can see, which Manasi, I already told, right? Duchenne is more bad than the Becker's. Duchenne is more bad than the Becker's. Okay, that's you should know. Okay, that part is done. Okay, next question. The next question we have is yeah, this part is done. Okay, very good. So what is this? This is also a very nice question. So yeah, this very true, very beautiful answer. This patient has what? What do you call this? So this one basically is the case of, we all know that it's a case of rachitic rosary. It's a case of rachitic rosary. It is because of which vitamin problem? It is because of vitamin D deficiency, rachitic rosary, right? Yeah. So you can say there's a beaded appearance. There's a beaded appearance at the costochondral junction. There's a beaded appearance at the costochondral junction known as rachitic rosary because of vitamin D deficiency. Remember that. This part is done. Next question. Yeah, this is important. They ask a lot of time in exams. Do you like her necklace? So it's a case of, we all know it's a case of Kessel's necklace. Who said vitamin B6? Jitender says So Arjun, lot of questions are coming from this. Okay, that's all I can tell you. Jitender's acha. Jitender said something, then Jitender said sorry. Jitender said something, then he said sorry. So, do you like her necklace? That is Castle's necklace. It is because of which deficiency? Vitamin B3. It is because of vitamin B3 deficiency. Which is vitamin B3? The answer is niacin. Niacin deficiency causes a problem known as pellagra. What are the three D's of pellagra? We have diarrhea, dementia, dermatitis, and death. Diarrhea, dementia, dermatitis, death is vitamin B3. Vitamin B3 deficiency causes pellagra, and this patient has a photosensitive rash. This patient has a photosensitive rash. What do you mean by photosensitive rash? As in, what do you call in the sunlight? If you go in the sunlight, basically, the rash comes. That's why the farmers, they have rash in the neck, they have rash in the thigh if they put the lungi little above. Scorbiotic rosary, someone is asking, scorbiotic rosary is because of vitamin C deficiency. Vitamin D deficiency, rachitic rosary. Vitamin C deficiency, scorbiotic rosary. And vitamin B3 deficiency is this one. एंड एक और भी था ना इसमें. हाँ, आपका स्टेपल डाइट क्या होगा? व्हाट विल बी योर स्टेपल डाइट फॉर दिस कंडीशन? योर स्टेपल डाइट विल बी मेज. मतलब रेगुलरली आप क्या खाते होगे? रेगुलरली इफ यू ईट लॉट ऑफ मेज यू माइट हैव दिस प्रॉब्लम. व्हाई? If I eat lot of maize, why will I have this problem? Because maize is deficient in vitamin B3. Remember that. And this is maize. This one. भुट्टा. ठीक है, बेस. Yeah, it is. Exactly, it is deficient in tryptophan, and that the story goes. That's it. So you give vitamin B3. That's it. Nothing else. Next question, please. So next we have is 1 second. Yeah, this is a good question. What's the daily protein requirement in a 2-year-old child? So what's a daily protein requirement in a 2-year-old child? Very beautiful. Abhishek Kumar says 60 gram. Very good. ठीक है. और Abhimanyu also says 60 gram. Very good. Someone says 25 gram. Very, very good. Smiley says 60 gram. Very good. I'll write your name. Okay, Smiley. Okay. Okay. Nayan says 13 gram. Okay. हाँ जी. Anyone else? और कोई? धर्मेश says 60 gram. और कोई महान आत्मा? हाँ जी. So पहले तो एक बार मैं पानी पी लूं, फिर गाली दूंगा. अच्छा, someone says 40 gram. अच्छा, कोई रह गया तो वही कर लो. इंकी मिंकी पोंकी फादर हैज अ डोंकी. So daily protein requirement in a 2-year-old child. What is the weight of a 1-year-old? 1-year-old is 10 kg. 2-year-old is 12 kg. 3-year-old is 14 kg. So I know 2-year-old is 12 kg. Number one. Number two, what is the normal protein requirement? It is 1 gram per kg per day. Your, mine, anyone. Right now my weight is 90 kg, so my protein requirement is 90 gram. This child is 2-year-old, should be 12 kg, so his protein requirement should be around 12 gram. So the best answer, the nearest possible answer for this question is 13 gram. So 13 is the best answer. So Smiley, तुमने 60 कैसे बोला? और धर्मेश हैं, अपना बता रहे हो हैं जिम जाने के बाद? क्या क्या कर रहा है? क्या हो रहा है? हाँ, ओके. Yes, Prakash. So what are the drugs given intratracheal? Any idea? What are the drugs given intratracheal? क्या दे सकते हैं हम intratracheal? So very importantly, we have the mnemonic. The mnemonic is nasal. N for naloxone. A for adrenaline. S for surfactant. A for atropine. And L for lignocaine. These are the drugs given intratracheal. Intratracheal. Remember always adrenaline, yes, it can be given intratracheal, but if I have to give adrenaline in a newborn, how will I give? Any idea? Now this is a PYQ. I know adrenaline can be given intratracheal, but एक newborn baby को देना है तो कहाँ देंगे? This na okay, Nathu, yeah, he says not umbilical cord. The best answer is umbilical vein. Umbilical cord तो बहुत बड़ा हो गया ना. Umbilical cord has two artery and one vein. So basically in the umbilical vein, if you have to give adrenaline injection, you will give at the umbilical vein. Exactly. Okay. Because the diameter is good and all that. There was a student who said, Naini sir, you told what you called intratracheal. So I ticked intratracheal. Adrenaline can be given intratracheal, but best route will be umbilical vein. And yeah, so very beautiful question. Dose. If you have to give adrenaline in umbilical vein, yeah, or a newborn baby, how much you will give? The dose of adrenaline is zero point 0.1 to 0.3 ml per kg in 1 is to 10,000 dilution. The dose of adrenaline in a newborn is 0.1 to 0.3 ml per kg in 1 is to 10,000 dilution. और कब देते हैं? Anyone? What is the indication of giving adrenaline? When do you give? Any idea? मान जाऊंगा मैं. I'll give you 10 rupees Paytm. अच्छा, पांडे कह रहे हैं न्यूनेटल रिसर्वेशन में देते हैं. अच्छा, ये तो ऑस्कर को भी पता है कि वहां देते हैं, पर कौन से में देते हैं? Yes, very good. When the okay, when the heart rate was less than 60 in a newborn, what do you do? Any idea? If the heart rate is less than 60 in a newborn, what do you give? So people are saying adrenaline. So that's wrong. If the heart rate is less than 60, you will give chest compression and bag and mask ventilation in the ratio of 3:1. If the heart rate is less than 60, you do chest compression and bag and mask for 60 seconds. If the heart rate is less than 60, you will do chest compression and bag and mask for 60 seconds. And if still the heart rate is less than 60 again, then you will give adrenaline. The indication of giving adrenaline is after 60 seconds of chest compression and bag and mask ventilation. Please remember that. Has everyone understood? Yes or no? This is important. If I ask you when do you give chest compression and bag and mask, you will say heart rate less than 60. When do you give ADR? After 60 seconds of chest compression and bag and mask ventilation. Okay. And one more question. If the heart rate is less than 100, okay, we have a baby, the heart rate is less than 100. Then what do we do? If the heart rate is less than 100, clear indication you will do bag and mask ventilation, BMV. And bag and mask ventilation is also known as positive pressure ventilation. Okay, remember that. And adrenaline is also known as epinephrine, and noradrenaline is also known as norepinephrine. Remember that. Okay. And what is the absolute contraindication of bag and mask ventilation? Any idea? कब नहीं देते bag and mask? The answer is congenital diaphragmatic hernia. The absolute indication of bag and mask is heart rate less than 100. And absolute contraindication is congenital diaphragmatic hernia. In a case of congenital diaphragmatic hernia, you will directly intubate the child. You will directly intubate the child. This was this year INI-CT question. A baby is having CDH, congenital diaphragmatic hernia, but the heart rate is less than 100. Baby is not breathing. What will you do? If the baby is not breathing, we'll put the baby on ventilator. That's it. Where do you see telephone receiver femur? क्या बना रहे हो किचन में? गला वो कर दिया, दबा दिया पूरा. Where do you see telephone receiver femur? Telephone receiver femur is seen in thanatophoric dysplasia type 1. Telephone receiver femur is seen in thanatophoric dysplasia type 1. Okay. Yeah. Nutan, what if there is obstruction in the trachea? If there is obstruction in the trachea, you first of all, why there will be obstruction in trachea? Imagine. It's a very random thought, actually. There should not be a obstruction in trachea. That's a very vague thing. Okay. हाँ, करेले ही बन रहे लगता है. एक्चुअली उसकी स्मेल आ रही है मुझे ना. आई एम गेटिंग द स्मेल ऑफ दिस कैप्सिकम विद लिटिल अनियंस प्लेटर काइंड ऑफ अ थिंग. हाँ, मिर्च हो सकता है. हाँ. Yeah, you can. Okay. Next question. Telephone receiver femur is seen in thanatophoric dysplasia type 1 because thanatophoric dysplasia type 2, the femur is normal. That's why. Next question, please. In this, I was showing a video of baby with single eye and no nose. Single eye and no nose. Okay. Yeah. Single eye and no nose. So single eye and no nose. Smiley has told a very right answer. Holoprosencephaly. Holoprosencephaly. Very important. एक ही आंख अगर दिख गई ना एग्जाम में और नाक नहीं है तो holoprosencephaly. In this one, when can a baby say bye bye? Any idea? A baby can say bye bye by 9 months. Okay. Remember monosyllables and bisyllables. Monosyllables and bisyllables. Monosyllables means ma, ba, pa. Monosyllables comes by 6 months, or bisyllables is ba, ba, or bye, bye comes by 9 months. Very good. Someone just now messaged they want to revise about the pneumonia and severe pneumonia. Can you please tell me what is pneumonia and what is severe pneumonia? So remember, fast breathing with or without chest in drawing. Fast breathing with or without chest in drawing, that is known as pneumonia. If there are danger signs, that is known as severe pneumonia. Fast breathing with or without chest in drawing is known as pneumonia. If there are danger sign as in, doctor, my baby is not feeding well. Doctor, my baby is in shock. Doctor, my baby is very lethargic. So fast breathing with or without chest and drawing is pneumonia. And what it called? Yes, derma girl. And danger sign is severe pneumonia. What do you give in pneumonia? The answer is amoxicillin. You give amoxicillin basically. And in severe pneumonia, you give injection. Which injection you will give? You will give MP Genta. MP Genta means ampicillin and gentamicin. That's what you give. And fast breathing. This is very important point. Fast breathing. What's the cutoff? WHO cutoff of fast breathing. So 0 to 2 months, 3 months to 1 year. What do you call? I'll write on a separate page. 1 second. So fast breathing. What's the WHO cutoff of fast breathing? So 0 to 2 months, 3 months to 1 year, 1 year to 5 year. Any baby having respiratory rate more than 60, 50, 40. 60, 50, 40. 0 to 2 months of baby having respiratory rate more than 60 is fast breathing. 3 months to 1 year old baby having respiratory rate more than 50 is fast breathing, and then more than 40. This is fast breathing. इस पे अलग से dedicated MCQ आता है. Okay, about the pneumonia. So fast breathing with or without chest in drawing is known as pneumonia. If there are danger signs also, that is known as severe pneumonia. Where do you see molar tooth sign? So molar tooth sign, yes, my dear, you're right, Smiley. You seen Joubert syndrome, Jubert. Guys, whatever you're reading, tell yourself you're reading for the first and last time. Okay, finish. Yeah, this is like a most exclusive rapid image based revision. Okay, look at the photo, tell the diagnosis. Look at the photo, tell the diagnosis. It is a molar tooth sign seen in Joubert syndrome. Next, where do you see eye of tiger sign? Eye of tiger sign. Eye of tiger sign you see in PKN. Eye of tiger sign you see in PKN, and that is pantothenate kinase. Pantothenate kinase associated neurodegeneration. Say with me, speak with me. Hanji, everyone speak with me. What is PKN? Pantothenate kinase associated neurodegeneration. You have to speak. I have done my MBBS. My MD also is over. I'm earning really good. So मेरे को तो आता है. You guys have to pick with me and be with me and become much more 1,000 times better than me. So say with me, eye of tiger sign is seen in PKN. Yes. Now अब अपनी गंदी जुबान से अब तुम बोले हो. And what is PKN? Pantothenate kinase associated neurodegeneration. Very good. You will clear. So what do you call them? Eye of tiger, and this is the eye of tiger. Okay, so this is the eye of tiger sign. Remember that. Okay, this part is important. Next question: where do you see tram track appearance? Very nice question. Where do you see tram track? Like your future, like your way of looking at life. Somewhere here, somewhere there. Tram track appearance you'll see in Sturge-Weber syndrome. So Sturge-Weber syndrome, you will see tram track appearance. Sturge-Weber syndrome, you will see tram track appearance. Remember that, okay? That's exam question. This part is done. Yeah, very nice. When the intestinal contents are out and they are what you call not, they are open. So this is basically gastrochisis. When the intestinal contents are out and this open, that's gastrochisis. And when there's no membrane, very true. And what about this one? When the intestinal contents are out, but they are covered in a sac, that is omphalocele. Very true. That is omphalocele. Very nice. Okay, this part is done. Next question. This girl is showing you teeth like that. Okay. Mortality तो नहीं होता डियर इनका, बस आप इनका abdominal defect है, आप ऑपरेट कराएं, बात खत्म. ठीक है. So what is this? This is geographic tongue. This girl is having geographic tongue. Is because of multivitamin deficiency. Geographic tongue is because of multivitamin deficiency. Geographic tongue. This part is done. Yeah. What is this? Now, this condition is known as clubbing. So, clubbing, very importantly, name some respiratory cause of clubbing and name some CVS cause of clubbing. Respiratory cause of clubbing is like, you can say ARDS, you can say COPD, respiratory cause of clubbing, or in heart, any hypoxic condition. Which hypoxic condition? You can say tetralogy of Fallot. Tetralogy of Fallot also the patient will have, because tetralogy of Fallot will have a body called pulmonary stenosis, and the baby will have hypoxia leads to end artery dilatation. Remember, or any hypoxic condition will lead to end artery dilation. You have to clear the exam, okay? Life is beautiful. You have to clear it, okay? You have to clear it. Yes, Nuthan, my dear, it is reversible for sure. Okay, next question. Okay, यहाँ पे इसमें आ नहीं रहा, so I'll not show that. Yes, color cannulas, always a favorite examiner's question. Color cannulas. So what do you think, guys? Okay, if I ask you blue color cannula is which number? Blue color cannula is 22. What about yellow? Yellow is 24. And what about purple? The purple is 26. What about gray green? Someone was answering in comment. Gray green 16, 18. Gray green 16, 18, and pink is 20. People who are answering right now has a huge chance till clear. देखो, शुरू के 3 घंटा तक तो हर कोई पढ़ लेता है. जो आखिरी के आधे घंटे में भी एकदम आंखें डंके की चोट की तरह बैठ के सुने और जवाब दे, जीत से पुसी की होती है. Anyone can hear in the beginning 3 hours of the class, but the last half an hour when you are very tired, exhausted, and then you are back to back answering, trying, you have won the show. Remember that. So 16 number candle is gray color, green is 18, pink is 20, blue is 22, yellow is 24, and purple is 26. Any other? Someone? Very good. किसने कौन बोला ये? Orange. Very good. Orange, yes, orange is 14, सबसे मोटा. The thickest one is orange, the thinnest one is purple, and all are even numbers except white. White is 17 number. Perfect, brilliant. People are amazing here. Very good. Okay, next question. Where do you see butterfly rash? Any idea where do you see butterfly rash? So butterfly rash you see in SLE. Yes, exactly. In SLE, you will see a butterfly rash. Yes. Could you please interpret this report of this child? They're asking an exam also. Could you please interpret the report of this one? Yes. What problem do you think the patient has in the picture? Abhishek Kumar Pandey said it's normal. तुम कहाँ रहते हो बताना था, तुम्हारे घर पे आके I would like to kill you, Abhishek. Okay, this patient has hemoglobin. What is the hemoglobin of this patient? If you can answer me in the comment, please. कितना है hemoglobin? Any guesses? The hemoglobin of this patient is 9.7, right? The hemoglobin of this patient is what you called. चल रहा है मेरी एप्पल पेंसिल हो गई. Yeah, the hemoglobin of this patient, very importantly, is 9.7. Yes, Rupesh, very good. So 9.7, what do you think? पौने 10 खत्म होगी, पौने 10. 9.7. So what do you think? 9.7. So 9.7 HP. Is it severe anemia, mild anemia, moderate anemia? So please remember, very, very important. Less than 7 is severe anemia. 7 to 10 is moderate anemia. 10 to 11 is mild anemia, and more than 11 is non-anemic. I'll repeat again, very important. Less than 7 is severe anemia. 7 to 10 is moderate anemia. 10 to 11 is mild anemia. And more than 11 is non-anemic. Now, this patient has hemoglobin 9.7. कौन से इसमें आ रहा है? The patient is coming into moderate anemia. So, in all, Dr. Jitendra is for 6 months to 5 years. As this is a pediatric classes by Dr. Anand. So, pediatrics we are talking about, not in you and me. So, Hanji, what next now? Exactly. If the child has anemia, I agree the patient has anemia. Don't you want to know which type of anemia is this? Have you heard of microcytic hypochromic anemia? Have you heard of macrocytic hypochromic anemia? Have you heard of dimorphic anemia? So, which type, which category the patient is falling into? Now, this patient, very importantly, has MCV 69. Hanji, what is the normal MCV? Can you answer in the comment, please? What's the normal MCV? Around 80 to 100. And what is the unit? Picogram or percentage? I'll give you two options, picogram or percentage. What is the normal MCV? Picogram or percentage? Picogram, percentage. Picogram, very good. Picogram, Anjali says picogram, very good. Okay, Smiley says picogram, very good. Very good. The answer is femtoliter. Okay, the answer is femtoliter. Remember, so MCV is 80 to 100 femtoliter. MCH is 30 plus minus 3 picogram. Okay, 30 plus minus 3 picogram. So MCH also is less than 30 and MCV also is less than 80. So it's a typical case of microcytic hypochromic anemia. Yes, microcytic hypochromic anemia. I'll repeat. So what are the, so I'll repeat again. In this patient, the patient has anemia and the patient has microcytic hypochromic anemia. And what is the differential diagnosis for microcytic hypochromic anemia? The answer is Sheetal. The answer is Sheetal. What is Sheetal? S for sideroblastic anemia. Okay, I for iron deficiency anemia. T for thalassemia. A for anemia of chronic disease. And L for lead poisoning. So this is a differential diagnosis of microcytic hypochromic anemia. Done. Next one. In this patient has HB9. The patient has HB9 and MCV is 108. Now, what is your thought process? This looks like a case of megaloblastic anemia because macrocytic anemia, one of the differential diagnoses is megaloblastic anemia. And for that, I have to get a vitamin B12 levels. And what is the peripheral smear finding on the megaloblastic anemia? Very common star mark exam question PYQ. The answer is hypersegmented neutrophils. Do you see hyper segmented neutrophils? Typical exam question. More than 5 lobed hyper segmented neutrophils is what they ask in exam in the macrocytic anemia picture of megaloblastic anemia. Last 20 minutes and this class is over. Hanji. A 5-year-old boy has put coin. A 5-year-old boy has put a 5 rupees coin over here. What do you want in this case? There are two options. Number one, wait and watch. Number two, remove it. Simple one, if the patient is asymptomatic, if I make your answer very simple, asymptomatic, what do you want to go? Asymptomatic, then you wait and watch according to the latest guidelines. Asymptomatic है तो wait and watch करो, और symptomatic है तो क्या करोगे? Remove करो. Endoscopic visualization and remove. Just remember this. Yeah. That's it. Yeah. What is stuck? But sir, it's stuck. अच्छा, it's stuck. अच्छा, मैंने कहा मुझे लगा वो internet stuck हो गया. How do you know it's stuck? If something is stuck, do you think he'll be sitting like this? You have to wait and watch for 24 hours. If still it doesn't go down, then you remove it. फिर वो बहुत आगे की बात हो जाती है. फिर वो आगे की बात हो जाती है, bro. वैसे देखा जाए तो हमारे हॉस्पिटल में तो ये लोग निकाल ही देते हैं. We don't even wait and watch. आया electively अपना intubate किया और इसको निकाल दिया करके. But button battery also, if it is a traumatic or pointed object, like any sharp object, then you remove it only. If the patient is not showing you any symptom, you wait for 24 hours, then remove. That's it. Hanji. So this patient has a vaccine which has a center part like that. And what do you call this? This is VVM. What is VVM? Vaccine vial monitor. Exactly. This is vaccine vial monitor. If I show you this picture only, what do you think? Is this vaccine good to use or it is not good to use? Yeah, Smiley is right. It is good. Pulkit also is right. If the inner square is white and the outer circle is blue, this vaccine is good to use, known as vaccine vial monitor. And one more vaccine, yeah, VVM over. Yeah. And this vaccine, one more line is written down here. It's written store at minus 20 degrees Celsius. If I ask you other question, below the VVM, it was written store at minus 20 degrees Celsius. Can you tell me like what you called this one? What are we talking about? The answer is OPV vaccines. all vaccines all vaccines are stored under 2 to 8 degrees Celsius except the OPV. Okay, yeah, except the OPV, which is stored under minus 20 degrees Celsius. Yes, in the ILR, ice lined refrigerator, where do you want to keep this vaccine? At the bottom, सबसे नीचे वाला, क्योंकि सबसे नीचे वही ठंडा होता है ना. और अगर हम डोमेस्टिक रेफ्रिजरेटर की बात करें, if I talk about a domestic fridge, then where do you want to keep this vaccine? The answer is sabse upar. In the domestic refrigerator, I'm going to keep at the top, that at the freezer, because that's minus temperature. And in the bottom ILR, I'm going to keep at the bottom. 7-year-old child came with complaints of arthritis. How do you approach this case? 7-year-old child came with complaints of arthritis. How do you, can you tell me some differential diagnosis? You are the doctor on duty. Yes, Jay keh raha hai history lenge. Which history are you talking about? Okay, okay. So, okay. So number one, do you want to ask out how many joints are involved? Is it monoarthritis, oligoarthritis, or polyarthritis? If it is single joint involvement, बस यही वाला ही है. If it's a single joint involvement, then what will you think of monoarthritis example? Can I say fracture? Can I say any trauma or fracture can have this problem? Can I say septic arthritis? Sepsis होता है ना, usually एक ही joint में होता है. Septic arthritis, tubercular arthritis, all these are single joint. Okay, oligoarthritis, biggest example is HSP, Hinong Schonlin Purpura, very important. It's less than 4 joint involvement, oligoarthritis. Yeah, yeah, more than equal to 4 is poly. An example, very important example of poly is acute rheumatic fever. So important. What is the name of the criteria for acute rheumatic fever? Any guesses? The answer is John's criteria. And where do you use Duke's criteria? Duke's infective endocarditis, use Duke's criteria. Very good. So these are the differential diagnoses of arthritis. Where do you see trident hand? Trident. So trident hand you see in achondroplasia. Trident hand you see in achondroplasia. Trident hand. Take it done. This you should know. Okay, where do you see? Okay, what is this condition? So this condition is known as, very importantly, phocomelia, limb defect. Yes, very true answer. Who is giving such? Abhi tak people are giving so right answers. Very good here. If the mother has taken thalidomide during pregnancy, the baby can land up into phocomelia, and phocomelia is nothing but limb defects. Okay, this part is done. Okay, next question. Yeah, if I inflate my BP cuff and my hand becomes like a carpopedal spasm. There is a carpopedal spasm in my hand. So I'm talking about tetany. I agree with you. Which sign are we talking about? We are talking about Trousius sign. We're talking about Trousius sign. So that is seen in latent tetany. Very good. Okay, there was a video in which what happened, I was occluding my both, if I was occluding my radial artery and ulnar artery, and then I open one artery and I was checking the change in the color of the hand. Okay, then what happened again, second time, this artery I occluded, then I opened this artery, ulnar artery, and then again I was checking the change in the color of my hand. So what is this test? This is known as Allen test. Okay, number one. This is known as Allen test, number one. Number two, why are we doing this Allen test? Very importantly, Allen test basically it is done before AV fistula. Because dialysis patient में ना हम fistula बनाते हैं, arteriovenous fistula. In the dialysis patient, because of repeated cannulation, we put a AV, make a AV fistula only, arteriovenous fistula, and for before making that, yeah, Allen test is done. This part, very nice. What is this one? Any idea? Long fingers. We have done that. So long fingers known as arachnodactyly. Yeah, long fingers, arachnodactyly. Which syndrome are we talking about? Marfan syndrome, that's very true. And Marfan, the mnemonic only is Marfan. So Marfan, the mnemonic is Marfan. Very importantly, what is M stands for? Any idea? So when the mnemonic is Marfan, okay, M for, which is the most common congenital heart disease in Marfan syndrome. The most common congenital heart disease in Marfan syndrome is a mitral valve prolapse, and the most common cause of death in Marfan syndrome is aortic dissection. You have to clear the exam, right? Imagine you sitting again after failing 149 marks, again sitting with me and talking to me again. You after six, you want to get 149 and talk to me like this only, or you want to come to my house and meet my mom, dad, and I'll take you somewhere out in my BMW, or maybe next month I'm buying XUV 700, a middle class car, so we can go in that if you want. So very importantly, mitral is this one. Exactly. So घर आना है ना, if you want to come to my house, most welcome. And Jay कह रहा है Mercedes ले लो. I did the test drive of Mercedes E-Class, but it's not that great. I'll buy XUV 700 only. It's very nice. Okay. So Marfan syndrome, the most common congenital heart disease in Marfan syndrome is a mitral valve prolapse. And the most common cause of death in Marfan is aortic dissection. R for retinal detachment. R for retinal detachment. F say fibrillin ka deficiency. There's a problem with the fibrillin gene, fibrillin deficiency. A for arachnodactyly, that is long fingers. And N for the patient can have pneumothorax. The patient can have pneumothorax. And Marfan's S. So S, you have superior temporal subluxation of lens. There is a superior temporal subluxation of lens. Basically, the eye of the patient, the lens of the patient, there is a subluxation, superior temporal. And remember a mnemonic, very important, HIM. What is this HIM mnemonic? In a disease known as homocystinuria. Homocystinuria disease is same like Marfan. All the features are same like Marfan syndrome. The homocystinuria patient also has arachnodactyly, everything. The only problem is IM. The patient will have inferior medial subluxation of lens of the eyes, whereas Marfan will have superior temporal subluxation of lens. Very important, guys. Please remember that. Next one. Yeah, nice question. Identify the syndrome. Identify the syndrome. If I give you three options, number one, the patient has this patient has a high arch palate. The patient has a high arch palate, number one. Number two, the patient has developmental delay. And इस patient का सब कुछ बड़ा है. The patient has large ears. The patient has large testes. The patient has a macrocephaly, large head. And what the patient does not have large? And no nose. Nose is not large. What are we talking about? We're talking about Fragile X syndrome. Fragile X syndrome. Remember. Yes, PK movie wala. Huh. Fragile X. Very true, dear. And Fragile, J also has a very right answer. Fragile X syndrome, very importantly, it is the second most common cause of mental retardation in pediatric age group. First most common is Down syndrome, and second most common is Fragile X syndrome, the causes of mental retardation. Mental retardation is now known as intellectual disability. The most common cause of mental retardation or intellectual disability, the first most common is Down syndrome, and the second most common is Fragile X syndrome. Is this a preventable cause or non-preventable cause? Smiley has very beautifully told these are the non-preventable. If someone is born with Down syndrome, he will born with Down syndrome. I cannot do anything. But the non-prevent this one what do you call preventable cause of mental retardation will be congenital hypothyroidism. So congenital hypothyroidism, if someone is having hypothyroidism, I can give thyroxine tablet and I can make the baby better. किसी को 80 साल के लिए पागल होने से बचा सकते हो, किसी फैमिली पे बोझ कम कर सकते हो आप लोग नॉलेज से. Knowledge plays a very important role. Knowledge is so beautiful. If you don't have a good knowledge, बाहर कुत्ता भी नहीं पूछने वाला तुम्हें, इंसान तो बहुत दूर की बात है. ठीक है, तो I'll repeat again. The most common preventable cause of mental retardation is hypothyroidism, and the most common non-preventable cause of mental retardation is Down syndrome, followed by Fragile X syndrome. And hypothyroidism patient, how the patient will present hypothyroidism? It is a typical exam question. Remember, very easy. PP. That's it. Okay. The patient will have a posterior fontanelle will open. Number one. The patient will have a puffy face. The patient will have protruding tongue और बड़ा पुअर सा टोन होगा बच्चे का. So very important points, very important. P बहुत easy है. P. That's it. Posterior fontanelle. This is the fontanelle. Okay, posterior fontanelle is open, puffy face, pot belly, protruding tongue and all that, and that's what. It's very easy. Okay. Next one. Very nice. Last 2-3 questions and the class is over. So टमाटर का क्या रेट चल रहा है आजकल? So this one is figure of 8 appearance. ठीक है? This is figure of 8 appearance. And where do you say figure of 8 appearance? Don't say TAPVC, my dear. Say supracardiac TAPVC. And which is the most common type of TAPVC? The most common type of TAPVC is also supracardiac TAPVC, जहां पे आपको मिलता है figure of 8 appearance. ठीक है? अच्छा, Russell-Silver syndrome is associated with which of the following? Russell-Silver syndrome is associated with what? Russell syndrome is one of the examples of uniparental disomy. Uniparental, same parent, disomy. Normally, one gene comes from the father and one gene comes from the mother. Whereas this condition is uniparental, same parent से ही disomy. The both genes are coming from the same parent. So Russell-Silver syndrome is one of the example. Then we have something very commonly asked in exam, something known as Prader-Willi syndrome. And then we have the Angelman syndrome. Prader-Willi syndrome and Angelman syndrome and Russell-Silver syndrome are the 3 examples of uniparental disomy. So Angelman syndrome. So Angel is the mother. So in Angelman syndrome, maternal gene, they ask in exam, which gene is deleted in Angelman syndrome? Angel is the mother, so maternal gene is deleted and paternal gene is doubled. Paternal gene is doubled. Whereas P for Prader-Willi, P for paternal gene, Papa wala gene, paternal gene will be deleted and which will be doubled? Maternal gene will be doubled. Just tell yourself, okay, the class has come to an end now, and tell yourself you're reading for the first and last time. Jaldi khatam. Uniparental disomy from the same parent, both the genes. So examples are Angelman syndrome, Prader-Willi syndrome, and अपना ये क्या था ये Russell-Silver syndrome. Angel is the mother, so maternal gene is deleted and paternal gene is doubled. And Prader-Willi syndrome, P for Prader-Willi, P for paternal gene is deleted and maternal gene is doubled. Only one example you need to know. I'll show you one. This okay. So this is Angelman. Okay, this is the what you call Angelman syndrome. What will come in exam? How will I remember this? Any special point I need to know? What is similarity of this picture and this picture? They are happy faces. They are happy. Yes, very good. Smiling. Yes. Happy puppet. Happy faces. So remember this very quick mnemonic. Please remember there was a micro puppet show. There was a micro puppet show which got delayed by 15 minutes. Just remember it like a story. And tonight, just before sleeping, call any of your friend and tell him quickly about this. What you called what you call angel man syndrome. Okay, so I'll repeat again. What you call of the angel man syndrome. Okay, they are the angels, no? Angels, happy puppet, happy puppet. Just call your friend today and tell, you know what happened. There was a micro puppet show. It got delayed by 15 minutes and make the mother very hyperactive. So micro puppet show, micro for microcephaly, puppet for happy puppet. There was a micro puppet show which got delayed by 15 minutes. Developmental delay and 15 chromosomes involved, which makes the mother hyperactive. The child is hyperactive and makes the mother bole to maternal gene is deleted. So angel is the mother, so maternal gene is deleted. Very beautiful mnemonic. Do you agree? Yes or no? Abhi learn bhi ho gaya. Yahi finish khatam. I'll repeat again. This is the angel man syndrome, and there was a micro puppet show which got delayed by 15 minutes, make the mother very hyperactive, micro puppet, microcephaly, puppet for happy puppet, delayed by 15 minutes, so developmental delay and 15 chromosome problem, make the mother hyperactive. Very, very important. For this, I would like to thank one of my very dear junior, Nayan, and he's from Nasik Medical College. He had made this mnemonic, and whenever someone helps, it's your duty to what you call uh, share people name and everything. Next, last we have is Prader-Willi syndrome. Prader-Willi syndrome. Paternal gene is deleted and maternal gene is doubled. Yes, yes, my dear Dr. Smiley. Yes. So Prader-Willi. How will I remember now? Prader-Willi. Angel Man, so I got it. It was a happy mother and happy faces and all that. Prader-Willi, at least looking photographic memory plays a very important role. I think I can appreciate obesity in this child. And imagine a patient with obesity with micropenis. The baby is having obesity. Obesity means he eat a lot. By looking at the photo itself, I can appreciate this child is obese. Imagine this child is obese, eating a lot, and having a micropenis. Okay, can you tell me any and one more syndrome having micropenis? It was the last year FMG question. The question was 28-year-old couple. 28-year-old couple are trying to conceive, and what he called on further examination, the husband had tall stature with a micro penis. Tall stature with a micro penis with gynecomastia. Any idea? Tall stature with micro penis with gynecomastia with 47XXY chromosome problem. The answer is Klinefelter syndrome. This was the PYQ again of the FMG. So 1,000 PYQs we have done. So these all things are there. Okay, so Prader-Willi syndrome. Quickly remember this one point. वो कहाँ गया? ये रहा. Again, Nayan had told me this. Father wali moti girlfriend. Father wali moti girlfriend. Father बोले तो the Prader-Willi syndrome paternal gene is related. Father wali moti. M for microcephaly, O for obesity, and moti. I for increase. I told you they eat a lot, okay, and intellectual disability. So my moti, father wali moti. Moti girlfriend is what we need to remember. M for microcephaly, O for obesity, and TII for increased appetite and intellectual disability. Moti girlfriend. Girlfriend is just to make you feel comfortable. अर्जुन कह रहा है अच्छा ये सारा एक्सप्लेन करो. इतना वेला में अगर लाइफ में अगर होता तो मैं हिमाचल चला जाता. माय डियर अर्जुन, दीज ऑल ARADXLR pedigree needs a very long explanations. Forget it right now. We can't do that one. So that's what father wali moti girlfriend is, what the examples wala what it called is we need to know regarding this one. That's it. That finished this class only. Oh my god, that finished this class. Has everyone understood this much? Yes or yes? Please let me know in the comment section. The class has come to an end. Life is beautiful. Thank you so much everyone for this beautiful participation. I hope you guys ढक्कन जैसे दिमाग में थोड़ा बहुत 19-20 कुछ समझ में आया होगा. Thank you so much everyone. A beautiful day today. समझ में आई? छुट्टी हो गई, छुट्टी हो गई, छुट्टी 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 हो गई. चलो 2 मिनट बातें करते हैं, इतने में ना मैं इस स्लाइड को वो कर लेता हूँ, क्या बोलते हैं अपने उसमें वो कर लेता हूँ, सेव कर लेता हूँ। सेव सेव। बिन तेरे, बिन तेरे, बिन तेरे, कोई खलिश है हवाओं में बिन तेरे, है क्या ये जो। और बताइए, और क्या चल रहा है? पीडीएफ भेजो। वही कर रहा हूँ, वही कर रहा हूँ, पीडीएफ भेजो, वही वही कर रहा हूँ मैं। If you want, what do you call, I hope you guys have my number, and I'll share the PDF file with you. Has everyone understood this much? Yes और yes yes। दिखा दो, किसको दिखाऊं? मैं एक बार देख लूं कि वो पीडीएफ ना वो होगी नहीं होगी, पता लगा कि पीडीएफ ही रहेगी करके। So the class has come to an end. Let's have a quick check. Yeah, this is our PDF. Yeah, all PDF are working well. Yes, congratulations. Congratulations and celebrations. Ta 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 ta. So before leaving, a last question. What is this video?
19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31,
Yes.
32, 33, 34, 35, 36, 7, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48। क्या नाम है बेटा? क्या नाम है? बताओ क्या नाम है? क्या नाम है आपका? आपका नाम बताओ।
Yes, very true. That's the right answer. The drug of choice is ethosuximide, followed by sodium valproate. And very beautiful thought by someone else who said in the group कि इतनी बार कोई हमसे अगर करवाए तो हमें चक्कर आ जाए. That's very true. So thank you so much, everyone. The slides are done. Everything is done, and we got the PDF file also. The class has been finished before time, and that's beautiful. And that's it. बस हो गया. इतने में इतना ही था. And best of luck. Do well. So most importantly, on the day of exam, please have breakfast and go. Okay, have curd and go. Have breakfast and go. Touch your parents' feet. Go to temple. Relax. Just smile on that day. And most importantly, before opening the question paper, 10 deep inspiratory and deep expiratory breaths. That's very, very important. Then only you open the paper. Okay. Yes, this is important. This is enough. As in, I would like to still recommend, if you have time, do a lot of MCQs also naturally. Whatever, if within 4 hours I could, do that, and I was able to tell you. I have given my mobile number multiple times. It's already there in the PDF file. My number is 9999897081. My number is 9999897081, and you can quickly, what you called, put a message. I'll share the PDF file with you. 9999897081. Please take care. Have a wonderful evening ahead. Bye bye, guys. And ये क्लास अब खत्म होती है यहाँ पे, ठीक है? Take care. Bye 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 bye.